Buenas and half a day. The Committee on Health and Veterans Affairs informational briefing is called to order. The time is 10:02 on Tuesday, February 4th, 2025. Thank you to those here with us today in person and those watching virtually. Notice of this hearing was provided to senators, stakeholders, and the local media on January 28th, 2025 and February 2nd, 2025, thus meeting the requirements of the Open Government Law. In addition, notice of this hearing was also posted on the Guam Legislature's website in the Guam Public Notice Portal. Materials for this hearing were shared in the committee drive and are available for print upon request. A recording of today's hearing will also be available online via Guam Legislature Media on YouTube. At this time, I ask all invitees and participants in today's informational briefing to come forward. Starting with GMH. Please state your name, title, and organization for the record. Start to my left.
Good morning. Thank you for having me. My name is Dr. Yame NYAME. I'm a neurosurgeon here in Guam. I'm also the Chief Medical Officer for GMH.
Morning. My name is Ricky Sabio. I'm the chairman of the Operating Room Committee at Guam Memorial Hospital.
I'm Jordan Pauline, legal counsel for Guam Memorial Hospital.
Buenas. I'm Lillian Posadas, hospital administrator.
Good morning and half a day. My name is Rodalyn Gerardo, Assistant Administrator of Operation at the hospital.
Good morning, Yuka Hechanova, Chief Financial Officer at Guam Memorial Hospital.
Good morning, everyone, and welcome to the public hearing room at the Guam Legislature for today's informational briefing regarding Guam's current and proposed healthcare facilities. Specifically, we are here to accept an update on the status of American Rescue Plan Act, or ARPA funds, any action taken to address the April 2020 U.S. Army Corps of Engineers assessment, and the latest update on the construction of a new hospital. I am Senator Sabrina Salas Matanane, chairperson of the Committee on Health and Veterans Affairs. Joining me today for this informational briefing are members of the 38th Guam Legislature's Committee on Health and Veterans Affairs. Joining us are committee members, Vice Chair, Vice Speaker Tony Atta, Senator Tina Muñoz-Barnes, Senator Vince Borja, Senator Shelley Calvo, Senator Chris Duenas. Also joining us are Senator Chris Barnett, Senator Will Parkinson, Senator Sabina Perez, Senator Joe San Augustine, Senator Therese Terlahi. I'd also like to acknowledge all of our hardworking legislative staff members, including those from my office that are here with us today. I appreciate all of the hard work. Thank you. Right about now, I am supposed to recite the rules of conduct and have all participants take an oath, but I don't think that we need that today. What we need is understanding. Understanding that the only way we can improve healthcare today is to care less about who gets the credit and more about arriving at solutions effectively and efficiently. We must agree to respect each other, to tell the truth, and remember that healthcare issues are much larger than our respective branches of government and our titles. Today's informational briefing seeks updates on planning and financing for a new proposed hospital and critical improvement projects at the current Guam Memorial Hospital. My colleagues and I simply want the truth from all of you presenting and participating in today's informational briefing. I want this briefing to begin the collaboration of all of us, public servants, working to move healthcare forward. There's too much speculation on cost and too much controversy on location of a new hospital and too many sides to the issue of healthcare. I have one side that I'm on, which is the people's side. I'm not here for acquiescence, nor am I seeking to be an obstructionist. My colleagues and I simply want the facts. Our people want and deserve to know the truth. We are kicking off today's informational briefing with an update on the $20 million in American Rescue Plan Act, or ARPA funds, allocated to Guam Memorial Hospital for critical infrastructure projects. But before we hear from GMH, let's provide some context and background for our viewers. On October 7th, 2024, the previous Oversight Chair, Senator Therese Terlahi, conducted an oversight hearing with GMH, during which the hospital provided an update on the status and use of $20 million in ARPA funds. Testifying at that hearing was Rodalyn Gerardo, GMH's Deputy Assistant Administrator of Operations. Here is a portion of that testimony.
All 20 million is obligated, or projected?
Well, we're tracking.
Okay.
So, sorry. We are tracking a total of 47 projects, and we're happy to report that 8 of those projects have actually been completed, totaling $963,300. We also have 20 projects totaling $7.5 million that we either already issued purchase orders and are pending completion or receipt of the items, or we are about to issue purchase orders, meaning to say the procurement has pretty much been done. We're just now on the tail end. We also have 19 projects that are currently in active solicitation, or we're about to issue the solicitation. Altogether, we have drawn down a total of $942,115 as of October 2, 2024. Again, keeping in mind that we have until December 31, 2026 to spend or to draw down on these ARPA funds.
You said you had 19.
Yes.
Okay, 19
active,
what? Because right now I'm showing drawn down is 11.
19 projects on active solicitation or about to be solicited.
Oh, plus 4,
right?
Okay.
So it's a 15 plus 4,
Okay.
yes.
Okay, thank you.
So pretty much this is our listing. We have been working diligently to track our ARPA funds. The $20 million that was given to us, we're trying our best to be, diligent and making sure that we're using the ARPA funds for projects that the hospital most needs. And so, again, as you can see, our team has been working really hard to obligate all of our funds, and barring any extenuating circumstances, we are actually confident that we're able to obligate all of these funds by the deadline of December 31, 2024.
Again, that was testimony from an oversight hearing held on October 7th, 2024. Testifying again was Rodalyn Gerardo, GMH's Deputy Assistant Administrator of Operations. After the October oversight hearing on December 2nd, 2024, in a story published in the Guam Daily Post, reportedly GMH continued to be on track with the obligation of the $20 million in ARPA funds. Once again, this is a quote from Gerardo. In terms of dollar amounts, $10.5 million or 53% of the $20 million has been obligated. Quote, we're trying really hard, and that's why we're certainly updating these numbers. Of course, our hope is to obligate all $20 million. We're going to take this down to the wire if we have to, up to December 31st. But our goal is to try to obligate all $20 million, however way that is. And so again, as we continue to look at the projects and their current statuses as far as where we're at on the procurement side, we're constantly making changes as we go along. One of the biggest projects, partially funded with the ARPA grant, is the Maternal Child Health Renovation Project, end quote. We have now learned that the solicitation for the Maternal Child Health Renovation, which again, partially funded by ARPA, has been canceled for the third time. This notice was dated January 27th, 2025, and that confirms the cancellation. Now, this is deeply concerning because maternal child health care services encompass labor and delivery, pediatric, PEDS ICU, and the newborn nursery neonatal ICU. During a recent tour of GMH, my colleagues and I saw firsthand that the NICU area is significantly smaller than this public hearing room. The fact that this project has been canceled yet again, and that a portion of the ARPA funds allocated for it could now be at risk, is incredibly disappointing. Another major project at risk, as of December 6, 2024, GMH's website indicated that IFB 021-2025 for the removal and replacement of Boiler 1 and Boiler 2 has been canceled. During my visits to GMH on December 19th and January 9th, hospital officials repeatedly emphasized the critical condition of the facility and the urgent need to replace these boilers. Boiler 1, commissioned in 1989, has exceeded its lifespan by 15 years, while Boiler 2, also commissioned in 1989, is 5 years beyond its expected service life. Again, it is important to highlight that this invitation for bid, which was to be funded through ARPA, has been canceled. To add to these concerns, during the January 29th Guam Memorial Hospital Board of Trustees meeting, it was revealed that GMH has only received 10 million of the 20 million it was expecting in ARPA funds. I attended that meeting via Zoom, and upon hearing about that shortfall, I took the opportunity to seek clarification during the public comment section.
This is Senator Sabrina Salas Matanane.
Oh, good evening, Senator.
Hi, good evening. You discussed earlier the $20 million in ARPA funds and that GMH received $10 million. Just for clarity, so the $10 million that you did receive, it went to pay vendors?
It went to pay some of the outstanding vendors, because the theory is that, we use that to pay whatever we collect that we can use for the CIP, is to free us up some of that money. That's the theory behind it.
But none of it actually went to any CIP projects?
At least some, correct me, Ronald, and some may have been used for the CIPs, but not quite sure.
Yeah, Ronald, do you want to chime in on this question?
Yeah.
So just to clarify, Senator Matanane, what is this? It was actually not a miscommunication. It was a lack of communication with BDMR. So what happened was,
I'm sorry, Ronald, are we talking about the $10 million you received, or the $10 million that you didn't receive at this point?
I'm talking about both. So what happened was, so with the $10 million that we did receive, yes, it is true we paid, we used it to pay vendors. There were some, because these were vendors, there may have been some CIPs in there.
Okay.
But the bigger CIP projects, as you know, these will take some time, so it's not like we can pay those yet. They will come due as the projects get completed. And so that's why the theory was that we would pay for some of our outstanding vendors now, and then as we collect monies, we would put that money aside so we could pay the vendors that we issued CIP projects, or for the CIP projects, if that makes sense.
Okay, and so what about the remaining $10 million? What happened? Because I thought it was supposed to be a total of 20.
Yes. So I was analyzing the BDMR reports from October, November, and December on their ARPA reports, and on that report, you can actually see that in October there was a $20 million allocation, which is what we've been talking about all along. And then somehow in their November report, which was dated December 5th, there was only, the $20 million was not there. And then In their December report, there was an additional $10 million here that was listed to pay vendor payments. So, yeah, so as our legal counsel mentioned earlier, there was a lack of communication from BBMR. Basically, how we're looking at this is that the funding of $20 million was taken away from us before they even communicated anything to us. And then $10 million was then added back into the account.
But you're still out $10 million.
Yes,
right.
So what we're doing now is we're looking at all these projects, all the purchase orders that we've issued, because we need to identify funding sources for these projects. Because as we've been talking about all along, these are all critical projects for us, and they're very important. And so because of that, we need to identify funding sources for them.
And so when you found out that you guys were short $10 million, what communication did you have with BBMR?
There was some, I think there was some conversations between legal counsel, but then there were, correct me if I'm wrong, because there were also other meetings that administration, not including legal counsel, so Lillian and Rodolin would have had with BBMR, DOA, and the governor.
The $10 million that you're now short, were any of those critical projects, were contracts signed already for that?
Some of them were signed, yes, ma'am. Yes, Senator.
Can I get, I guess, we could probably wait for the informational briefing then, and you can provide, which projects are impacted, I guess, that already have a contractual obligation.
Yes, we will get that.
Okay. All right. Well, thank you so much.
Thank you, too. Thank you also for your yes.
Okay.
Yes, thank you for running our meeting. So okay. It's actually nice to have senators show up and listen to what we do here. So thank you for coming.
Well, I appreciate all the work you guys do. This is...
While GMH cited a lack of communication, the governor's office issued a press release over the weekend stating, quote, funds initially designated for GMH capital improvement projects were not obligated in compliance with U.S. Treasury guidelines due to technical challenges, including procurement and design issues. Recognizing these constraints, the administration took responsible action to reallocate these ARP monies not obligated by the statutory deadline to pay down other operational liabilities at GMH, freeing up hospital funds for approved projects, end quote. Now, late yesterday, we received a notification that BBMR Director Lester Carlson was not going to be able to attend today's briefing. However, provided documents indicating that the amount of ARPA funds allocated to GMH totaled nearly $54 million, dating as far back as 2023. He also then commented on the most recent $10 million allocated to the hospital to pay vendors. He noted that the reason why the remaining balance was not transferred was because based on, quote, after very careful legal review and discussion with GMH, it was determined that GMH was not able to satisfy the rigid U.S. Treasury obligation requirements, and thus the amount of approximately $9.1 million was transferred into the new hospital account, where it could be firmly obligated under U.S. Treasury's guidelines. These transferred funds were kept in the healthcare space and remain available for expenditure by December 31st, 2026. This also resulted in Guam fully obligating its ARPA monies. Accordingly, and not a penny of ARPA funds is slated for return to the U.S. Treasury. The Leon Guerrero Tenorio administration firmly supports GMH and has demonstrated this support in conjunction with the legislature on numerous occasions. The administration recognizes that with a mandate to treat everyone, regardless of their ability to pay, GMH is in need of annual subsidies, and with the rising cost of health care, the consideration of mid-year subsidies should be considered. Again, that was a statement via email from BBMR Director Lester Carlson, which explained why GMH didn't receive the remaining $9 million and that ARPA funds went to the new hospital. To summarize, we were all under the impression that Guam Memorial Hospital would receive the full $20 million in ARPA funds when a number of colleagues and I visited GMH on December 19th and again on January 9th. I specifically asked if there was confidence that the entire $20 million would not be lost. Both times the response was yes. Matter of fact, Candid News, along with KUAM, were at the tour on January 9th when we were discussing the $20 million in ARPA funds.
Pretty much on the fourth floor, yes, because of the leakage on the roof, and that's one of the projects under the one of the CIPs under the ARPA that we are moving forward with the
How many projects are under ARPA? So there's about
757 or 67. Right. Mm-hmm. And it's not just the facility and the assets, but also medical equipment are in that list. Procurement and some of the medical equipment.
And I know when we met last time, we were talking about technology, computers, things like that.
Yes.
That's also included in your
It's included. Right.
Okay.
And what's in the pipeline also is the fixes. That's the automated dispensing system. Those are coming. They'll be coming arriving sometime February.
Yeah. The units, the equipments themselves should be arriving around February, March timeframe. The pharmacy team is already working with the vendor to, I guess, work on some of the advanced things that we need to do. But the idea is hopefully we can go live by the summer on the new system.
Is that inclusive of that electronic record system you're talking about?
That's correct.
Okay. Is any of the ARPA monies obligated toward that?
For the EHR? Yeah. No, we didn't because we need to do the RFP. Okay. But before we do the RFP, we have to have some funding and secure for that. We didn't get that onto the ARPA list.
Well, I'm just happy to hear that out of the $20 million, none of it is going to be returned.
Oh, no, we don't want to return. Right. So, we need a hospital. Anything else?
Again, that was on January 9th when my colleagues and I conducted a tour of the hospital. Again, we were all under the impression GMH did not lose any of the $20 million, and 60 ARPA-funded projects were going to move forward. Yet today, we find ourselves in a much different reality. Before we move forward with the presentations from GMH and other government officials today, I want to set a few ground rules for my colleagues. After each presentation, all senators will have 5 minutes to ask questions. There will be no yielding of time to another colleague. You either use your 5 minutes or forfeit it. Questions should be relevant to the presentation and subject matter at hand. I want to reiterate that this is an informational briefing and an oversight hearing will likely be scheduled at a later date. I also want to recognize Speaker Frank Blas Jr., who is with us today, as well as Senator Tello Taitagui. Lillian, you and your team may now proceed. Please begin with the status on ARPA funds.
Thank you, Senator. On behalf of the Board of Trustees, if I may just, speak a little bit on my opening remarks that I prepared. On behalf of the Board of Trustees, management, medical staff, employees, and the patients we serve, we extend our appreciation for this opportunity to engage with this legislative leadership in a constructive, healthy, solutions-driven strategic dialogue, as well as present you the detailed briefings and updates on the specific topics with regards to the efforts to address the U.S. Army Corps of Engineers April 2020 assessment of the hospital and the ARPA funds for the CIPs. As the hospital administrator, I, as well as all the respective leaders of our executive management council, are extremely concerned about the physical state of the hospital's architectural, electrical, fire protection, life safety, mechanical, information technology, and communication systems, structural and other concerns highlighted in the 2020 U.S. Army Corps of Engineers Facility Assessment Report. And yes, even with these concerns and issues, we continue with a steadfast heart and resilience to carry out our duties and responsibilities to keep our one and only hospital operational as premised on our new mission statement. I won't say our mission statement. With me this morning, they've already introduced themselves, but I also like to recognize some of the executive leadership who are not physically here, but they do contribute tremendously to the daily discussions and decisions regarding the hospital's operations. Ms. Danielle Banglonia, she's the Administrator of Quality, Patient Safety, and Regulatory Compliance. Dr. Laura Lizama, who is the SNF Medical Director. Ms. Pauline Lizama, she is the DOC Hospital Nursing Supervisor. Ms. Bel Rada, Assistant Administrator of Professional Services. Christine Tucaro, she's the Assistant Administrator of Nursing Services. Lizelle Concepcion, Deputy Assistant of Nursing Services. Ms. Amy Edmondson, she's our Acting Hospital Administrator, HR Administrator. And we have Legal Counsel Jordan with me to my right, and I have Robert Weinberg, I don't know if he's here. And then, of course, Dr. Ricardo Eusebio, who introduced himself earlier. And the others I don't need to mention because they introduced. Before I begin with the PowerPoint presentation at the outset, please allow me to emphasize and highlight some of the crucial historical facts about the hospital. Per the legislative findings, GMH has historically been in a deficit landscape since the local government acquired and took over from the U.S. government the role and responsibility of providing hospital services to the people of Guam. Prior to 1956, free health care and hospital services were provided. After 1956, the original Guam Memorial Hospital was constructed at the southern point, and therefore, free health care and hospital services continued. In the 1970s, because of this free health care and hospital services, the hospital's deficit was $9 million. In 2015, the deficit increased to $15 million. In 2019, the deficit reached $30 million. Just recently, we closed fiscal year 2024 with a deficit of $40 million. Last week, in a preliminary briefing with our Medicare cost report consultant, after a week of reviewing our fiscal year 24 data, we expended $31 million in servicing the Medicare beneficiaries. However, our eligible reimbursement will only be around $14 to $16 million, depending on the settlement adjustment that we may receive per the discharge rate. So that's already a significant loss in our collections, reimbursement, and that's just for the Medicare beneficiaries. So again, we rely on the legislature, because this is a government hospital, to provide funding to ensure that the hospital's mandate to provide care and treatment regardless of their ability to pay. Additional significant events and facts that has contributed to the current status of the hospital is, we all know we had COVID-19 pandemic. Although we received millions of dollars from the CARES Act and several other federal funds, cost of healthcare, medical, pharmaceutical, and surgical supplies have escalated more than 20% and still rising. Wages for health professionals, doctors, nurses, radiology technologists, technicians, respiratory therapy professionals, and other clinical personnel all have increased and will continue to increase in order for the hospital to recruit and retain these professionals. We've resorted to utilizing staffing solution agencies that deploy travel nurses during the COVID. We expended $59 million throughout that time from 2020 and only received 50% reimbursement from FEMA. So there's that big expense again that we had to incur. And although enhanced and expanded, we expanded our telehealth and telemedicine capability to augment some of the clinical service areas that are greatly needed, such as intensivist physician for the neonatal, pediatric, and adult intensive care unit. Also, throughout this period of the COVID pandemic, some manufacturing companies in the U.S. closed while others increased the cost of their medical and surgical equipment and products. In March 2023, we had an IT network shut down, and that really just impacted us significantly, not only on the clinical side, but on the financial side. We had such a challenge in making sure that we capture those charges, and we bill for those charges with the insurance and with Medicare and Medicaid and MIP. Then 2 months later, in 2023 of May, Typhoon Mawar hit us, and it caused significant damages to the hospital's physical structure. We had a lot of things that we needed to fix, in addition to what the Army Corps had already, highlighted. And then the private insurance payers, they're not only slow in paying, but oftentimes they deny the claims of the services that we provide. So that's a big challenge in itself. So even though throughout these calamities and major events and setbacks, our dedicated and resilient staff continue to roll up their sleeves to ensure we deliver the care and services. I wanted to highlight some of the successes, but maybe what we'll do, because I know you're all waiting for some feedback and updates on the ARPA funds. And if I may preface my statement with that, is that yes, in 2024, Governor Lulian Guerrero committed 20 million ARPA funds for the hospital's critical CIPs. However, only 10 million was released. Because of the confusion and the difficulty in fulfilling the procurement requirements per the CFR and the state local fiscal recovery fund obligation deadline, it was equitably advantageous and beneficial for the remaining 10 million to be reallocated for the building of the new hospital so that we do not lose those funds if we do not obligate them by December 31st. And yes, Senator, in our meeting, I said, and I gave you my word, that we will obligate those 20 million. And we tried as best as we can. We diligently, we burned the midnight oil, preparing all those procurement documents, procurement records, the purchase orders, the contracts. Unfortunately, the definition of obligation per the legal counsel was that there's more rigid requirements that I was not aware. So yes, I said I will obligate those, but unfortunately, we did not meet the deadline. So therefore, we only had the 10 million that we then paid down some of the vendors, and some of those vendors were contractors for some of the CIPs. So the 10 million went and reallocated to the new, for the new hospital, which is what we really need also. So if you have any other questions, or I can hand it over to Rodalyn, who can speak more about if not the ARPA funds, and also the CIPs and what we have done to address the citations and the findings, the highlights of the Army Corps assessment that was done in 2020. Thank you.
You can proceed, Rodalyn.
So for ARPA first?
Yes.
If you can pull up this, the PowerPoint presentation, page 11. Okay. So on here, we're tracking again the critical infrastructure projects, which all of these originally we were tracking as part of the 20 million ARPA. As you can see here, the total at the very far right is now 54 projects totaling $18.2 million. So not quite the 20 million, but there's an explanation. So as you can see though, the status itself is that we've already completed 17 of these projects totaling $1.9 million. The remaining 37 projects are pending project completion, meaning to say we've already issued the purchase order for these. For the bigger amounts, we also have signed contracts. And for the most part, a lot of the projects you'll see, if you go to the next slide. Next slide, please. These are all the 17 completed projects. So of course here is the installation and commissioning of the power source for the L&D nursery OB ward. Okay. I'm just going to name a few of them because I'm sure you guys can read them on the slide. We of course completed the liquid oxygen enclosure and the tanks expansion project. We've received the 4 pickup trucks as well as 1 cargo van. And on some of the equipment here, we have the acute care bladder scanner. We received 2 CT scanner tubes. Originally, we procured 1 because the CT scanner tube for X-ray room 1 or CT room 1 went down. But then later on in the year, the second CT scanner tube went down, so we had to procure that as well. So that's why you'll see 2 on this. Of course, we also received the servers to replace our existing servers for our IT department. We also got firewalls, and then we received several computers as well. And so there's your list of 17 projects completed. And then on the next two slides, you'll see these are the other 37 projects that we're tracking that we've already, again, issued purchase orders, contracts, went through the entire procurement process. But as Ms. Lillian had pointed out, I guess there was some confusion as far as what we thought would meet the definition of obligation, and then as BBMR had pointed out, what they thought. And so because of that, we did really work diligently to try to get all of these projects through. As we've been saying this entire time, all of these projects are critical to our hospital. We need every single one of them, if not more. But because when we learned later on just this year that, okay, officially it's just 10 million, so that's why we're sitting here and trying to figure out what other funding sources we can use to pay for these other projects moving forward. But I do want to say that we are also trying to work with the administration to identify additional funding sources to try to, get these paid in addition to our collections. Mm-hmm. Yes, and then just to address earlier, you mentioned about the MCH IFB being canceled. So what happened was we issued out the IFB, I think sometime in October, and then based on feedback from the interested bidders at the time, they required more time. So we actually extended the deadline for the IFB. And then we extended it again a second time, not canceling, just extending. The last extension was in December. And by that time, unfortunately, we did not receive any bids. And so the right thing to do, because we were trying to use some of our ARPA monies, was to cancel, and the plan is then to resolicit. So it's not like we're just canceling and not going to move forward with it. It's just that at that point in time, it did not make sense to try to push it when we were trying to see if part of the ARPA funding could be used towards that. And since we were kind of, getting to the 12/31 ARPA obligation deadline, we did not think it was responsible at that time to extend it any further to see if we can get any bidders. And so the plan is then to, this year, right, in 2025, to then revisit also the scope of that project, the entire project, as well as the bid packets, to make sure that everything is in order. Is there any changes that we need to make before we reissue it out? We've actually also reached back out to the bidders that, the interested vendors, right, interested bidders that registered to receive the IFB, and the game plan is to ask them, is there anything that we need to do or to improve? Because part of it was what we were hearing was that the project was too big, and because a lot of them were tied up with other projects, they were not able to bid at the time. But we wanted to get that in writing, so, again, just to be, fully honest and transparent with you, that's what happened with the MCH. Now, on the boiler IFB, that was also canceled because we were going to use ARPA funds for that. And when the bid submission came, we also did not have any bids. So there was no point of keeping that open. We didn't have any bidders submit any bids, and so unfortunately that we had to cancel. So that's our ARPA, or at least for this version of this portion of the critical infrastructure projects.
Okay, I'll open it up for questions, and I'll start. And again, for my colleagues, you have 5 minutes each to ask your questions. No transferring of time, so 5 minutes, you use it or you lose it. Just for clarity, 17 projects completed. Was that paid for with ARPA funds? All of it?
800, so as you can see, if you go back to slide 11, you'll see that we've actually submitted a total of $1,075,863 to DOA for payment prior to December 31st, right? So like, probably all the way up to sometime in December for these specific projects, or some of these projects rather. And what was paid out of DOA that we're tracking is a total of 11 of these projects, totaling $887,699. That leaves us a balance of $980,089 that we would have to pay with general fund or whatever other funding sources.
So can you break down what you used the $10 million that you did receive in ARPA funds to pay vendors? Who got paid? What was paid for?
I don't have that listing with me, but we can provide that later. If that was the DOA. Yeah, the 10 million. Yeah,
so
we have that, but I just don't have it with me right now.
And the 30 purchase orders that were issued, again, we're going to have to find another funding source for. Okay.
Yes, ma'am.
According to BBMR Director Lester Carlson's statement, GMH received a total of $53 million in ARPA funds since 2023. Where did all this money go?
Some of it went to operations, particularly for like the travel nurses that we weren't able to pay when the invoices were coming in. So DOA helped us cover some of that expense.
Marlon, did you have anything to add?
Sorry, I'm looking through the BBMR report just to see, to make sure I give you accurate information. Part of it says here, claims from ARP Act related expenses. So I guess what happened at the time, this was from since 21, I guess expenditures in 21 and 22, they paid about $17.3 million. And then another $8.3 million, majority of that went to pay for travel nurses, the travel nurse service, rather, for the companies. And then about $16.9 million was used to pay our vendor payables. So throughout the time frame, I guess from 21 until up until 2024, different times of the year, DOA helped pay on our behalf several vendor payables because we kept falling behind.
Also, the angio suite that we were able to install and launch, that was also some of the funding that was paid for that in medical equipment.
A lot of things ramped up over the weekend with regard to the ARPA fund. So I've got to ask, how does it make you feel when you hear that it's because of basically your failure and your team's failure that you lost out on the remaining $9 million? And this is basically just based on the releases and the statements that I received from Lester and the press release from the governor's office.
I try not to look at it as a failure or anybody's fault, but that this is really what happened. This is the fact. These are the facts. And so moving forward, I have a responsibility as the hospital administrator to try and find some alternate funding. And so we're looking at a grant that was for HVAC. It was a $3.6 million funding source for the HVAC replacement at the hospital. There's a balance of like $1.6 million in that pot that we're looking to see how we can use that funding to help us also with our, with the CIPs. But this is where we're going to need to really put our creative minds, our intelligence together to look for some, funding, and even probably even cut some of our expenses. It's not going to be a popular decision, but as an acute care hospital, we really shouldn't be providing outpatient services. But we needed to, like for cardiology, for gastroenterology, and for even pulmonology. We're not doing it as a primary care provider. We're doing it for those individuals who are hospitalized and they need follow-up care for those specific types of conditions. And so that's why we're providing that. But it is costing us, and we're not able to capture a whole lot of those expenses. But if we need to cut so that we can then have some funding available, then that's a decision that is not going to be a popular decision. But if we have to, we will have to do it.
Okay.
Thank you.
I've received numerous concerns from employees of GMH, to include nurses, that are concerned about the financial situation, the politics, allegations of mismanagement at the hospital, and concerns about the hospital's structural integrity to be able to withstand another storm. And that was relayed to us when we had the tour and in the meetings we had with you. Now, with the loss of this $10 million, you're the managers. How safe is GMH in your opinion?
Thank you for that question, but as it was also highlighted in the 2020 Army Corps of Engineers, there are many, many deficiencies of that old hospital. Architecturally, the roof and the envelope needs to be repaired, needs to be fixed. The mechanical part of it, the electrical part of it, our information technology, it's an old system that we need to procure hardware for it and even software. And other areas of the hospital, yes, the wall hardening needs to be done because inside also probably the mold. So those are many issues that we need to fix that hospital. During my war, part of that wall in the hallway was ready to collapse. So we got that repaired and fixed. And so structurally, the building is old and it is falling apart, but we continue, and that's why we need a new hospital. To repair all of that, it's just gonna be more money that is not gonna meet the new accreditation and standard codes. The Army Corps pointed out that even the tile we need to replace, but we don't even have the money for that. The walls and the height of the rooms, we can't even fix that because again, you have to tear it down. The rooms themselves, they cited us for the fact that we have semi-private rooms, and so HIPAA and privacy is a concern because the beds are just divided by curtains. So if a doctor comes in to talk to you about your medical condition, the patient in the other bed is hearing everything. So yes, we were cited also by the Army Corps that is a big failure on this facility. Therefore, again, all the more I'm going to keep saying, we need to build a new hospital. And that new hospital will ensure in our internal task force, talking about it and trying to envision how this new hospital, each room will be a private room with even the cardiac monitoring capability, because those are the kinds of conditions that we end up in ER waiting for a bed. And so those are the things that we're looking at, but yes, absolutely.
Right. And Lillian, I don't think anybody disagrees that our people deserve and need a new hospital, especially the employees at GMH agree that we need a new hospital. But again, you mentioned that this assessment was completed in April of 2020. And when I see that Lester Carlson from BBMR is saying that GMH received up to $53 million in ARPA funds since 2023, where are the improvements that you've been talking about?
So majority of the amounts that GMH has received were primarily to help pay for operational. The only amount that was really, allocated towards CIP was the $20 million, which again didn't come or we did not know about it until October 2023. That's when the administration provided us the $20 million for CIP. Prior to that, everything else was really to address operational needs.
Okay, so the 30 million went to pay, didn't go to fix anything at GMH, basically. Just to pay vendors and go to operations. Okay. I'll go ahead and open up some time now for my colleagues to ask questions. Vice Speaker.
Thank you, Madam Chair, and thank you to GMH for coming out today on the informational hearing. You mentioned that $10 million is what you guys received and expended, and out of that $10 million, $1.8 million was already spent, right, for these projects here that you have. 1.8 million?
Yes, $1.8 million was completed, yes.
Right, so the remaining of that, of the, what is it, maybe 7.3 million, where did that funding go to? Out of 10 million?
Yeah, so so just to be clear, we completed $1.9 million in projects. But of that, $887,000 was paid for with ARPA funds. And then the remaining is still payable on our end.
All right, so where did, of the $10 million that you guys, that they didn't touch and stayed with GMH, what was the rest of it used for?
So at that time, this was towards the end of December, the funds were used to pay for our vendor payables, really, like whatever was outstanding. So we paid for
supplies and things of that nature?
Pharmaceutical vendor payables, as well as our other contractors, including payroll vendor payables, not the payroll to the employees, but the vendor payables, for example, our withholding and
yeah, it's quite disappointing that, you know, you knew you were coming down for an informational hearing and that we would be asking these questions on where these fundings would have gone, and not having that information here today is just quite disappointing. I think that when you look at over the years, $53 million, that's a lot of money to give to the hospital, and it's just not $53 million in ARPA funds. But throughout the years, the legislature has appropriated funding to GMH to help take care of, for example, the electrical panel. I believe $10 million was appropriated for that. And what did that $10 million get used for?
Electrical panel?
Yeah.
We did not get any money for the electrical panel. When was that? Because we did not get any funding for electrical panel. Right now, what we're working with is GPA on an agreement that they come and they do preventive maintenance. But that electrical panel is where it is right now, and it's still the same. It hasn't been constructed or relocated to a different location away from that, you know, water reservoir. So I don't recall getting $10 million for the electrical panel.
Okay. Well, just look back over the years of what was appropriated to the legislature and where all those fundings have went. And has any of the ARPA funding been used to hire employees?
Not that I know of, sir.
None? No ARPA funding has been used to hire?
No, not for recruitment, not for hiring.
Okay. And so you were mentioning that 23 million, the 20 million was given to GMH in October of 2023 to obligate, right? For
we weren't
CIP.
given, if I may correct that, we weren't given. That was what was committed for the hospital to use for its CIPs. We did not have access to that account or that money.
Yeah, it was committed and eventually it was given because eventually you guys got it. So since October 2023, have you been trying to move forward with it? And then you were mentioning that you did not have what was the eligibility criteria for the use of ARPA funds, right?
The obligation definition.
So they did come out with the SLFRF obligations, right? How to obligate it. Did you guys get a copy of that? You did. Yeah. Yes? So, and that came out since July of 24. So how is it that we don't know what was eligible and not eligible to use ARPA funds for? And how is it that we got $9 million taken back from GMH so that it can go to the new hospital, and GMH not completely utilizing the $20 million that was given to them?
It's not about the eligibility of those projects. It was then the definition of obligating. And so we started the ball rolling in terms of the procurement with IFBs, but keep in mind that procurement takes a while. You know, we can issue the IFBs, but if contractors, you know, don't respond. So that's one of the issues too, is the procurement process.
I totally agree with that. But when we got there in December, we were assured and reassured that the entire $20 million that was given to GMH will be completely obligated and nothing will be returned. And I know that when they say return, it didn't go back to the federal government, it just didn't stay with GMH. Now it's going to the new hospital. And now we're going to try and find ways to be creative, to get more funding to GMH so that we can do what could have been done with ARPA funds. And now we're going to have to look for the general fund or other means to do the same projects that were not completed.
Yes, Senator, I gave you my word and I assured you that I wanted to obligate that $20 million for the CIP because we really needed to fix all those critical projects such as the chillers and the AHUs and the roof and envelope repair and the wall hardening. But you know, again, my understanding of that obligation definition is that we will provide all the documents, procurement documents, by December 31st. I did not realize that there were other rigid requirements that I needed to make sure I fulfill. So yes, you can beat me up for that because that was my fault. But
no,
you know, now we're beyond that.
No, we're not beating you up on it. It's just that there were what they call it, notifications and things like that of how to obligate these funds were put out since. And if there was no understanding of it, then you should have went to the experts of BBMR, whoever it may be, so that they can turn around and say, guide you, right, or guidance. And there's nothing wrong with saying, you know, I don't know the answer to this, can I get it? And you'll be able to move forward with that. But because of the fact that now GMH lost $9 million in additional ARPA funds to do what needs to be done at GMH, now we're going to have to do creative thinking to find out where we can find that $9 million to now do what ARPA funds could have done. So,
thank you, Vice Speaker.
Thank you, Madam Chair.
Senator Will Parkinson, I understand that you need to leave, so I'll go ahead and allow you to begin your questioning.
Thank you, Madam Chair. So based on Ms. Gerardo's explanation from the last Board of Trustees meeting, the BBMR report released on December 5th on ARP funds and obligations that the $20 million ARP money was reduced. That was on December 5th. The deadline for obligation of the ARP was December 31st. So why were the funds taken away on December 5th?
So we were going under the understanding that, again, like Ms. Lillian said, we have until 12/31 to obligate all of these funds. We were not aware that it was going to be reduced by December 5th. Now, keep in mind, I reviewed these BBMR reports only in January already. I didn't, again, all of this time, and even when you guys came to visit us, we were under the impression we had $20 million, so we weren't lying about that, you know. So, yeah, we were confident. Are we going to obligate all 20? Yes. But unfortunately, you know, later on, after the fact, looking at the BBMR report, so later, you know, again, right, in hindsight, and hindsight is 2020, we should have been, could we have all communicated better? Yes, we could have all communicated better. We could have been more, communicated more with BBMR and DOA and all of that, but, and then likewise, they could have communicated with us. Again, we did not know until later on that the funds were taken away on December 5th.
You didn't know until January that
Correct.
The funds were taken away on December 5th?
Yes.
And you didn't know because nobody communicated? Why didn't anybody know?
I don't know exactly from our end, but we've done a lot of research on our end as to the cause of this. It appears that BBMR or DOA had communicated an earlier callback deadline to many of the agencies. I have done an extensive review of communications in and out of GMHA, and it does not appear that that deadline was communicated into GMHA. So by the time we were actually sorting out some of the differences at the end of the year, we just didn't have time to sort them out, and that's when the decision was made to reallocate some of the funds. But for us, we were working on the December 31st deadline when a deadline had been set for most of the government earlier, but it just never, whether it was communicated and didn't make it through, we were inadvertently left out or whatever it was, that the earlier December 5th clawback date was not something that GMHA became aware of because we don't have any record of communication related to that.
Okay, so can you do a little bit of deep dive of what happened here? You said there was a misunderstanding about the requirements for obligation under the ARP funds. Can you break down when you were informed of that, and what were the missing requirements, and why was the legislature not informed until late January if the obligation had failed on December 5th?
From GMHA's end, I don't think there was a failure of obligation. I think some of it is a difference of opinion onto what the obligations are and some of the requirements are. GMHA has, we have procurements that have been conducted in particular manners for several decades, and and so there's some disagreement over thresholds and which rules apply in circumstances. And so I'm not sure so much that it was a failure of the obligation documents as much as there was some disagreement over some of the technical specifics. And by the time that we were actually sitting down to deal with it, there just wasn't sufficient time to go back and forth to resolve the differences, because we're looking at we're looking at the last several days of December at that point, and not something earlier. I think one of the disagreements, for example, is over the extent that a purchase order satisfies an obligation. The CFR does define it as an obligating document. Legal counsel in the governor's office and some other officials thought that there was more that's needed than that. And so it is an obligating document. It satisfies the obligation, but there's just some disagreements over the extent of it and what documentation needs to go into it. I'm confident with our obligating documents, but also at the end, when you're sitting down on December 27th facing a deadline, there's just not enough time to sit through and resolve some of those differences.
Okay, and I just got one last question. How are we going to hold people accountable for not obligating this money in time?
First of all, I don't think the money has not been not obligated. Guam did not lose any of the $20 million. The allocation to GMH is what was
yeah, we just made a $10 million oopsie.
So it's not a $10 million oopsie, it's a $10 million disagreement. The other thing too is we are looking at other funding sources to satisfy some of the projects that we have outstanding. Portions of them can be incorporated into other projects we have ongoing as well. And so it's not, yes, I understand the concern, but it's also not just, it's not a lost $10 million.
Okay, frankly, whether I'm in the public sector or in the private sector, if I have a $10 million oopsie or disagreement, whatever euphemism we call it, I would have that person's job immediately. As a private sector individual, I would fire someone for that. As a governor, I would fire someone for that. I am neither of those things. And all I could do is say, I've lost faith in the management of this hospital, and I would ask for your resignation. That would be my solution to this. I think we need new leadership. And so with that, Madam Chair, thank you for the time, and thank you for the questions.
Thank you, Senator Parkinson. Mr. Byrne, could you please come to the table in case anybody has any questions? Department of Administration Director. Thank you, Mr. Byrne. We will proceed with questioning. Speaker Frank Bluss, Jr.
Thank you, Madam Chair, and Thank you very much for being here today. I want to get back to, Lillian, when were you informed, let's go back again to timelines. When were you informed that $20 million was going to be made available to GMHA from ARPA?
When were we informed that 20 million?
Right.
Back then, remember when the legislature committed 30 million and appropriated?
Mm-hmm.
And so the governor then announced her commitment of 20 million for the hospital, specifically for CIP. So it was at that time, same time.
Do you recall what year that was? I think it was
23? October 23.
October of 2023.
Mm-hmm.
So would it have been very safe to assume that if you've got the commitment from the governor for the $20 million, you would have already started the process to be able to encumber or at least obligate that funding?
We started the listing, identifying and determining which ones will be the priority.
Right.
Yes, we started, and so we presented it to the Board of Trustee subcommittee on CIP, the discussions and determining which ones will be then the priority. But then the initiation of the procurement process, such as an IFB, did not start till 2024? 2024.
Okay. Was it your understanding that you had to spend all of that money by December of 2024 if you were to receive that $20 million?
It's not to spend, but to obligate it.
Obligate.
Right.
And thank you very much. That's what I needed to get to, because didn't you feel you had sufficient information necessary? Granted that you may have, it did fall under some guideline and whatnot. I'm a little confused here as to why you was committed and you have the ability to obligate it. What was the reasoning why, again, I'm sure you said it before, but I need you to repeat it. What was the reasoning the administration gave to you when you finally learned about it, that they de-obligated $10 million of what they committed $20 million to for?
If I may backtrack a little bit.
Sure.
Remember in 2023, we had the IT shutdown.
Right.
And so we didn't fix that overnight.
Right.
It was ongoing issues and problems that we kept going through. Then 2 months later, we had that Typhoon Mawar with very serious and very significant damages to the hospital. So those were also ongoing activities that we needed to deal with. So yes, maybe we got so distracted dealing with those situations that we didn't begin the process for the procurement for those CIPs until when Rodolin came on board in 2024. That's when we started, okay, now we can really concentrate on getting those CIPs rolling in terms of the procurement process. But to your question, Senator, when did I find out that the money, the 20 million, was not available anymore?
No. It was, well, you know, we understand. First off, your procurement itself is not going to happen overnight, certainly not in 3 months. But the commitment, the obligation, the encumbrance of it, so that you can continue. Now, understanding, and correct me if I'm wrong, Mr. Byrne, but the understanding is that basically while you can encumber it before December 31st, you must expend it fully by September of 2026. Am I correct?
December.
Understood. So, so the encumbering and expending and procuring two separate items. And I'm just a little bewildered here as to, first off, what led them to de-obligate $10 million of what they committed to you?
You want me to answer that question?
Yes, if you can.
I do not know what led them to that decision, other than we did not meet all the rigid federal requirements.
It's kind of interesting because you were supposedly the decision to deobligate it from you happened December 6th, right? Of which you didn't know about. When did you finally realize that it was deobligated, or they took $10 million from you?
Around December 27? Something like that, yeah.
December 27.
Yeah.
So from December 6th to December 27, somebody should have informed you. You should have been informed so that way you can stop this process or fix the process to be able to meet those guidelines. Is that correct?
We continued to process
I
all that
understand.
purchase
And
orders. We continued.
What I'm getting at is they put you between a rock and a hard in a rock and a hard spot. Okay? They deobligated it in December 6th. Didn't tell you until December 27th. That time frame could have been utilized to fix some of those processes that were necessary to be able to ensure that on December 31st, whatever you need to turn in to keep that money was there. I don't fault you for that. I don't fault you for that. Okay? There's something else that we need to be able to look into. Mr. Byrne, do you have any idea as to why it was deobligated on December 6th?
I think we should not use the word deobligation.
Okay. Why did you take it away from them then?
May I finish?
Yes.
All the ARPA funds were allocated,
yes,
not obligated.
Right.
So at a cabinet meeting at the end of November, the governor made it quite clear to all cabinet members that without having a firm plan for the use of these funds and the obligation of these funds by December 2nd, there would be a reallocation of the funds that were not properly notified to BBMR as being obligated. As we went through this, people, meaning people in agencies, began to submit these plans, and the amounts, because we're talking of a deadline of December 31st for the obligation of the remaining funds, which was over 200 million, it was like a crossword puzzle, making sure that we didn't lose the opportunity to use every dollar of those funds. So while this process was going on, we learned that the GMH was trying to obligate some funds after this deadline that had been notified, and that's when we had to have a further meeting with them, which we didn't have with other agencies, to finalize the amount.
So there was a December 2nd deadline?
Yes.
Were you aware of that, Mr. Lumian?
No, Senator, that was not communicated to me or to any members of our executive team.
Okay, I think my 5 minutes is up. Thank you very much, Madam
Thank you, Speaker. Senator Tina Munoz-Barnes.
Matanane C2, Madam Chair, thank you very much. I'm probably going to do this another way because based on the presentation this morning and based on what we've been going through in the past terms, I'm going to ask the 3 questions so that I don't lose my 5 minutes, but I'm going to ask you guys to literally just kind of write the questions down and then answer it, because it's only going to be 3, but it impacts what you presented today and as far as the ongoing issues that have been happening. So please bear with me. Thank you, Madam Chair. My first one was, how severe would you categorize the violations or deficiencies noted over the last 5-6 years by the CMS? Besides those related to the costly CIPs, have these deficiencies and violations all have been addressed? How much ARP funds have been used to address these violations noted by CMS? That's number 1. Number 2 was last term, we had focused discussion on cybersecurity and the hospital's security breach that was part of a legislative hearing back then. Can you detail any findings or recommendations of this cyber threat, including any parties responsible, and what measures are now in place to better protect GMH's IT infrastructure, patient information, and government data. Based on that, how much in ARP funds have been used for this purpose? And then my last question, Madam Chair, so I don't lose my train of thought here, is it has been my understanding that based on testimony that the hospital has provided to this August body, the GMH is consistently needing to fill critical staff positions. Just recently, I received calls, and it was noted to me that there were a lot of employees at the hospital today. As a matter of fact, I think it's 1,500 employees on its roster. How many employees, including contracted workers, are working at GMH? How many are being paid with sunsetting funds? And I guess I just heard earlier that ARP wasn't being utilized, but maybe any other grant programs? And how many employees does the hospital literally need to adequately care for our island and Guam's sole public hospital? And I ask these questions, Madam Chairs, because I really want to just try to find a better understanding of how we can move forward with the hospital. I literally grew up at the hospital. My mom was the PIO, working there for over 40 years. And I know they say the hospital is a political football, Madam Chair, but we get updates, and I think what we need to do is find the solutions to those pending issues that have even happened in the past, because these things keep accumulating, and we keep shooting, like the good speaker said, you know, is it to you to blame, or the administration to blame, or the information that's not being provided to this August body? And what the chair noted, that you noted, Madam Chair, is how do we move forward from today? And when I was looking, I didn't receive this earlier, so I just received this today. So these questions were building up from, you know, what has happened in the past, and what updates do we need to look at today? But it's really disheartening to know that, yes, you guys have a lot of listed projects, but they were deobligated. And if we were to follow this plan on everything, you would have assumed the full 20 million. That should not have been taken away from you. I'm just wanting to find that. And even these three questions that I brought up over the course of this hearing, because I'm a committee member, is these things are still not answered. So I just, Madam Chair, I know if they can't answer it today, they could come back with an update, but I think it's crucial because these inquiries have been going on for a while now, and if there's things that we need to right-side, mitigate, or facilitate to help reduce or improve or get the funding necessary for the equipment and the staffing that is needed, the proper staffing that is needed, then we can work from there. So thank you, Madam Chair. I hope to hear the answers on at least several of the questions I inquired about.
And you can provide those responses in writing.
Yes, ma'am. If I may speak,
go ahead.
I'd like for us to just kind of rise above this mindset of blaming who's at fault. Can we just stop that kind of mindset and questioning and just go with the concerns and the issues that we all need to work together to fix? Because this is a government hospital. You as legislators, me in my role as as administrator and our team here, if we just look at the issues and continue to work towards the solutions and not say, okay, it's your fault or it's their fault, I'd like for us to just stop that kind of
Lillian,
mindset.
I don't think we're playing some sort of blame game here. We just need the truth so that when we move forward, we can make informed decisions to improve health care for our island. Committee member now and Majority Whip Senator Shelley Calvo.
Thank you, Madam Chair.
Buenas and half a day, everyone. Thank you for being here. Ms. Lillian, it was stated earlier that there was some misunderstanding on the requirements for ARPA money obligations. Now, like you mentioned, I do not want to assign blame to anyone, but I do want to move forward to ensure this does not happen again. In the future, is there any guarantee that this misunderstanding will not happen again? What has been done or will be done to ensure that this is not an issue in the future for federal funding granted to GMH?
Thank you for that question. I think communication is really what's key, both ways. You know, I should have taken the initiative to ask clarification and communication, what really is the deadline? Because my understanding is December 31st. Based on my reading of the SLURF obligation definition, that was my understanding, was December 31st. And so that's how we were working. And I should have clarified and asked people, is it still the same? So communication is very key. I can't guarantee that we can prevent, but certainly we can then ensure through communication and clarification that we are all clear on the same page.
We need to be truly careful about that because it's actually a very tiny lapse in miscommunication that is actually costing us a lot. So in the future, I would really like to see that we pay attention to details, even the smallest of the details. Now, I'm really more curious about, and I'm more interested in moving forward and a solution to what we are confronted with right now. So you mentioned earlier about identifying other funding sources. And you can you please elaborate further on the status of these funding sources that you're looking into? Are we close to finding eligible funding sources? And are they going to truly address, you know, these pending capital improvements that we are supposed to take into consideration?
Thank you again for that question. I've listed about 3 alternate funding sources, and one of them, as I mentioned earlier, there was that DOI HVAC grant. It was $3.5 million, and we've expended some of it. There is a balance of $1.6 million that we may be able to tap into, like for the AHUs, because that's within that HVAC grant application that we submitted. So that's 1.6 that we're looking to have. The theory behind using or reallocating the 10 million from that 20 million ARPA fund to help us by paying the vendors, then the theory was that we can then free up 10 million from our collections. But the key, again, is collections from our payers. You know, Medicare, we know already that we're going to be short with the reimbursement. Private insurance, if we can work with the private insurance to at least increase the reimbursement rate and make sure that they don't deny our claims. You know, if we can get at least 90% reimbursement from the insurance, that will help us with our collections that we can then use towards the CIPs that you know, are still pending. And then the other one is the incorporating the envelope wall hardening. That's part of a CIP for the MCH, which we are looking at first and second floor to expand the nursery as it was identified by the Army Corps. It's really very small space with that OB nursery and NICU. We need to expand that. So that's part of the MCH renovation.
Sorry, how much is that one?
That one was appropriated by the legislature, the Public Law 36-107. That's $15 million that was appropriated. So, you know, that's something that we could tap into for that particular envelope and wall hardening for the first and second floor at the same time, the MCH.
And what is the ballpark figure of total amount of collectibles that you're expecting?
10 million is what we're collecting on a monthly basis.
10 million?
Collection on a monthly basis.
Can you clarify your, are you asking about our monthly collections or
Yes.
about, oh, it's about,
And the private, from fees that we're expecting to collect?
from our charges, it's
Yes.
about 10 to 11
Yes.
million a month.
10 million. Thank you for that. Thank you for answering the question. My last question. With 10 million being used for vendor payments, which capital improvement projects pending completion will now need to be funded by money collected through GMH? Sorry, and also, is there a timeline or a schedule available for the pending projects listed in the submitted presentation?
Okay. Did you want to speak on it, or? I can start. The 6 critical CIP projects, the replacement of the 40 AHUs, those are the air handling units, that was estimated to be 1.9 million. We already issued the purchase order, and the contracts have been signed since December 20. The 2 450-ton chillers and its cooling towers, that one is priced at or tagged at 2.3 million. We also issued the purchase order, and the contract was signed in October 25. The one 265-ton chiller and 3 condensing units, that's about 970,000. Purchase order was issued, and contract was signed also in October. The front courtyard, center courtyard parking expansion, that's tagged at about 815,000. Purchase order, and the contract was also signed in December. The automated medication dispensing system, this is the Pyxis automated medication dispensing. Those have already, the purchase order and the contract have been signed, and the equipment is already going to be delivered by the end of March. So that's about 800,000 that we need to pay. Oh, sorry.
Thank you, Senator Calvo.
Go ahead.
Thank you so much.
Thank you, Senator Calvo.
Thank you, Madam Chair.
Senator Chris Duenas.
Madam Chair, and thank you to the panel for being here today. For me, I'm clear by the questioning of my colleagues on the chain of events transpiring, so I'm going to shift to a couple of questions of exploring possible replacements of funds. Maybe I'll go to Director Byrne first. You are administering at DOA the master grant of the ARP funding. Is that the way this is working?
Yes, Senator.
Okay, so in my history of having managed grants in other agencies, there is commonplace to have consideration for reprogramming. So since you had already moved from the GMH 20 million set of projects over to the new hospital, have you been in contact with the hospital or even the grant administrator for this particular grant on the possibility of reprogramming?
Senator, the ARPA funds are different from other grants. We got a lump sum of money right at the very beginning, if you recall, in 2021. US Treasury informed us, other than the fact that we went to US Treasury and asked I think the Deputy Secretary at that time, if we could use some of the ARPA funds for the hospital. We are guided simply by the rules that they issued, and there was an interim final rule, an interim rule, a final rule, another interim final rule, and about 70 frequently asked questions that they issued. They specifically told us that they were not going to respond to any specific inquiries and always referred us to the documentation that was generally available.
So is that no?
It was not possible. It's a different type of grant from a regular grant.
I understand. It makes sense. So moving on from there, there was also, under the Biden administration, a grant issued separately from ARPA for infrastructure. I believe that was Tyrone Taitano, who is the director of that particular program. Are there any eligible funds in that infrastructure grant proposal to consider hospitals?
I'm not aware of any, Senator. I'm not an expert on that particular grant. I'm not aware of any, but many of them were competitive. That's not to say that there wouldn't be for a hospital. It's just additional information.
So Lillian, my advice to you then would be to work with your fiscal team and see if that's a possibility. I know that, there was a lot of consideration for those funds as well, but in my humblest of opinions, given the critical nature of the hospital, in the event that this is a possibility, I think that it will be certainly worthy to take a look, and maybe even in that infrastructure grant proposal, there may be projects that have not been obligated for, or even in the queue, that might fall far below what the critical nature of what we're looking at here. Other than that, Lillian, I really think that, there's no question, and this is just a final comment, and I think you share this, there's no question that we're going to continue to, and the next phase of this is discussed, the updates on the new hospital progress, but we cannot lose sight of the fact that this is absolutely imperative. If I'm going to have to work with you probably if these other things fail, but the fact is that these projects must go forward, that hospital must be repaired and must be maintained in a way that is capable of carrying out its critical mission for our people. So we'll get through this and figure out where we go from there, but I don't think that can be overstated. Thank you, Madam Chair.
Thank you, Senator Duenas. Senator Vince-Porra.
Thank you, Madam Chair. Thank you to the panel for coming down here today. I'm not going to get into a lot of the questions or some of the details, like Senator Duenas said, we've kind of been through what has happened and why we're here today. I think, and I asked this while we were on the tour, and I'll ask it again. Given the hospital's current state, and I know some of the, projects that were canceled due to realignment of the funds, should a typhoon come, right, and you guys remember this question, will the hospital still be able to conduct its operations, have surgery? I know you guys also talked about, having to transport people to the radiology center to get the CAT scans or whatever, or MRIs. What is the plan with just everything going on? We obviously are not going to pass another budget until the end of, towards the end of the year. I know you identified some potential grants to go look at, chase, but if that doesn't happen, what are your plans considering the hospital's current state?
Again, collectively, we really need to look at, because like you pointed out, if we have another typhoon, we could lose the hospital. And so we need to figure out where we will need to evacuate these patients. You talked about surgeries during typhoon. Those services are curtailed or suspended till we're back to condition of readiness 4. But during condition of readiness 2 and 1, we suspend elective surgeries. But your question, I appreciate very much, but again, I ask that we come together as a community to identify where we will need to evacuate these individuals should a major disaster falls on that hospital and it collapses. During Mawar, internally, we had to shift and evacuate patients from one area to another area where it was kind of safe and it wasn't leaking. But the bigger picture is that whole hospital, should it fall apart, where do we bring them to? And that I haven't gotten an answer.
Thank you. And then my other question is regarding billing. There was a period when a private vendor handled this for GMH. With its current status of some of the fundings and just the procurement, did outsourcing improve collections and efficiency, or are we seeing better results with the in-house billing?
Are you referring to that MedHealth consultant, the RCM?
Yes, the third party.
Okay, I'll let Yuka, our CFO, answer that.
We did gain a lot of benefit from the contractor when they were on board. We did let them go, mainly because they really had some internal issues. It seemed always replacing the on-site consultant. And I felt that we were at a point where we had learned enough and developed a lot of procedures and quite frankly, we really reorganized the revenue cycle side. And so we did improve a lot. We did have a big setback when the network went down, because we did have to pause a lot of our activities, but we were able to bounce back. So I think right now we have a lot of good monitoring processes that we've developed as a result of it, and really bringing the revenue cycle to be more cohesive, whereas before it was really siloed.
Thank you. That's it, Madam Chair. Thank you.
Thank you, Senator Borja. Senator Tello Taitagui.
Madam Speaker, I came late. I'll go ahead and yield to my colleagues who came before me and wait my turn.
Okay. Senator Therese Terlahi.
Madam Chair. Thank you all for your presentation today. So my question is, so you say there was a disconnect between your understanding of obligation of the funds, and then you also say that it was actually a timing thing, that you didn't submit to BBMR or DOA by December 5th versus December 31, what that obligation was. So, Mr. Byrne, could you clarify, was the money removed because they didn't submit their report to you by December 5th, or because they didn't obligate the funds by December 5th?
I'm not sure it was either in the way that you streamed it. There was a deadline of actually December 2nd.
There was a what?
Deadline of December 2nd for all agencies to submit their final ARPA request to BBMR. And I don't, obviously, from what I'm hearing today, the personnel at GMH either didn't understand or misunderstood, so it wasn't received. Between December 5th and December 31st, when the obligation should have been completed, BBMR, DOA, and the Governor's Legal Counsel looked at some of the contracts and purchase orders that we learned for the first time were being considered to be spent under that ARPA obligation, and we were concerned that they did not meet the criteria for federal funding issued both by the Treasury under the rules that I spoke about a bit earlier, but also under the CFR rules, and that they would in fact be disallowed on an audit by Treasury or indeed our auditors doing an annual audit on compliance.
Are you saying that they were not eligible?
No.
Then what?
They weren't compliant.
Why not?
They didn't meet all the federal rules that are required by CFR, which is the general rules, but also by the specific rules under the ARPA Treasury rules.
Yeah, but could you tell us, because we want to know that the government has been spending ARPA funds since 2021. How could they not follow the rules or know the rules?
Well,
they've got two lawyers. They said they have a disagreement with you. What was the disagreement that DOA or BBMR could not let the entire government understand?
I can't answer why they didn't understand it. We had a meeting. We talked to, well, it wasn't me that expressed it. It was the Governor's Legal Counsel clearly expressed that he didn't feel that the obligation was properly made.
Okay, because they had made their plan very open and obvious to the entire government, including the Fiscal Review Committee, since they presented it at least to us in 2024, right? And even 2023, when they got the promise of the 20 million, they laid out what their priorities would be. 2024, they laid out how they were going to proceed, and it sounds to me like for this entire time, they've not been told by anyone that that's not going to be eligible or make it under the guidelines that you're describing.
I think, Senator, that the devil is in the details. It's the way that the obligation was made. And, I'm sure you wouldn't, or anybody else would want us to have a finding that might result in the return of these funds.
Absolutely not, but that's why I'm asking, how could that happen in December versus early on when they made their plans? No. When we gave when the legislature and the people of Guam, the taxpayers gave 30 million in extra funds, not really extra funds, but in general funds, taxpayer money to GMH. At that same time, there was a commitment by the governor to give 20 million in ARP for CIPs, because we were only trying to pay their operations, their vendors that was in dire need, and yet they had dire, crucial needs for CIP. 20 million was promised. At that same month, the same time that she passed the bill for the 30 million, the same time that she dedicated the 20 million or allocated 20 million ARP, she created by executive order a fiscal review committee. It comprised of you, Mr. Byrne, DOA administrator, BBMR administrator, and the governor's head financial advisor. Those three were supposed to advise GMH on how to make sure they spend this ARP money correctly and within the deadline. That's one of the stated purposes of this fiscal review committee. Lillian, did you receive any advice from your fiscal review committee that you were not proceeding with this ARP funding correctly? That you were not going to be able to use it by the deadline?
My apologies. It was at the December Fiscal Review Committee meeting when we attended it with the DOA director, the legal counsel, Mr. Jeff Moots. That's when we were told that the money, the full 20 million will not be available and only 10 million will be available to them to pay down the vendors so that then it can free up our collections. That was the discussion at that meeting in December.
Governor's legal counsel, not even part of the fiscal review committee, but
he attended it so that he could
yeah.
advise us with regards to the status of that 20 million ARPA.
So, Mr. Byrne, the money that was not given to the hospital in ARP was allocated elsewhere, obligated elsewhere. Where was it obligated?
It was allocated towards the new hospital. If you recall, the original amount that was going to be allocated to the new hospital was 300 million. In the event, there was only, after all these reallocations had taken place, including significant payments of ARPA operational funds to the hospital, there was the residual amount left available was 104 million.
Right. So this money, this $9 million, or $10 million that was moved from GMH over to the new hospital, how was it obligated? How did it get encumbered or whatever was necessary for it to meet the guidelines?
There was an IGA with GIDA to obligate the funds.
A what?
IGA, Intergovernmental Agreement.
An agreement with GIDA was all you needed to obligate the funds?
Well, all of it is not, it's understating what was needed. It was a very significantly complex document.
Thank you, Speaker.
That was not available to GMH, an IGA like that, to obligate these funds for GMH purposes?
Well, that wasn't really the issue. The issue was what they had done wasn't compliant.
Thank you, my time's up.
Thank you, Senator Terlahi. Senator Joe San Augustine.
Thank you, Madam Chair. To the panel, thank you for being here. I was listening to all the questions posed to you all, and I remember specifically one of my colleagues asked the question, what's the revenue of GMH 10 million? What do you pay out every month?
Our expenses every month are about 15 to 16 million.
You generate 10 million, you pay out 15 to 16.
Mm-hmm.
Very interesting. And what are you doing to reduce that expenditure so that you have money to do what you need to get done? I'm just curious. I'm trying to keep it simple, okay?
One of the things I do is we try very hard to control the requisitions that come through. So we have a lot of requisitions for supplies and pharmaceuticals, and those are the priority. Payroll is also a priority. What does not become a priority are these like facility type projects or expenses for the facility, because we really try to focus on making sure we have the supplies and medication to take care of the patients.
Okay, when you mention payroll, I keep seeing information that the the size of the hospital should have been how many employees and what do you got today? I'm just curious. I mean, it almost sounds like DOE, you know, you got 36,000 kids before, now you're down to 24, and you still got 3,000 or 4,000 employees. I'm trying to understand where GMH is going. Because 3 or 4 years ago, I was the author of the bill to build a new hospital, and it never moved anywhere. And this current hospital is just falling apart. And I'm looking at this agenda, and I'm like, we're just spinning our wheels. We need answers. That's all the chairwoman's asking for. Give us an answer. Tell us where you're going so we know how to help you get there. But it's obvious, if you're going to say since 21, was that the COVID money came in, 22 or 23, you had access, you were given 53 million. Then recently you were supposed to be given 20, you only got down to 10. If you didn't know how to obligate and spend, how did you succeed with 53 and then not able to obligate with 10 more? I'm just trying to understand the madness in that. How can somebody on one end say, you're doing good, but now you're not doing good, but you're doing the same thing? I'm just trying to understand that. Because at the end of the day, you're going to have to come back anyway to this committee and figure out how you're going to justify to get your budget, or other than the oversight, but your budget. And you know, you can't just keep throwing money at you guys and say, okay, do what you need to do. And when you come up with a list of items you need to fix, that should be already a priority list that is established, and it doesn't change tomorrow. It stays the same. So those IFB, whatever you need to kick out, kick them out. Get the business to say, you know, we can get that. When you kick out the RFB, we're going to bid for it. Not wait until we got to do it in 3 months, por favor. But thank you for all being here. And I'd like to ask a bunch of other questions, but time is costly. Thank you, Madam Chair.
Thank you, Senator San Augustine. Senator Chris Barnett.
Madam Chair, and good morning to the panel. Boy, it sure is a lot of information to take in here this morning. But I think one thing's for sure, if the governor tells you that she's giving you $20 million in ARP funds, you should be able to bank on that. No pun intended. Well, maybe pun intended a little bit. And I know there's been a lot of talk about the blame game, but I think we need to be careful in saying that, because there's a big difference between playing the blame game and determining who's responsible for the loss of this $10 million. And, you know, dispense a light to the GMH panel, but it kind of sounds this morning like the administration threw you guys under the bus. And now we're hearing that you kind of like it under the bus. And we rarely have agencies that come before the legislature lawyered up. So I think that's also interesting that you categorize this as a $10 million disagreement, a $10 million difference of opinion.
Yes, I think Governor's legal counsel and I have just fundamentally different views on some of the definitions of obligation and other things, and so I think that's where the disagreement is, but they work for the governor.
So you're of the opinion that GMH did do everything it needed to do to obligate these funds?
By and large, yes, without looking at all of the smallest purchases and the details, but by and large, I would say yes.
And Ms. Lillian, I hope you can make it through this hearing without resigning again. But you had said that there was a lot of confusion, and that at the end of the day, the taking of the $10 million and the reallocation of it towards the construction of the new hospital would be more beneficial for the people of Guam. But I struggle to reconcile that in my mind because we've seen in media reports that the governor is trying to take the entirety of the $500 million grant that's coming down soon, and then she's also said on the record that she's going to seek another $300 million. So I don't see how the taking of this $10 million is more beneficial when we're adding it to the mountains and mountains of millions of dollars that the governor is putting aside for the construction of the new hospital, wherever it may be. And so I guess now you're working on the other funding alternatives, even though the money was already there. And I also disagree that it's more beneficial because we have GMH. I mean, you yourself had said on the record in the previous term that it should be condemned. We had Dr. Akamoto say that it's pretty much condemned. And then we also had the chair of the health committee say GMH gets a big fat F. So I don't see how the taking that $10 million is beneficial when we're putting it towards a project that we don't even have a clear idea of the timeline for completion. So that $10 million is basically going to this new hospital black hole, and we might not even see the benefits of it for 8 to 10 years. So I fail to see how the immediate pressing needs at the Guam Memorial Hospital take a back seat to this process and construction of the new hospital. I'm kind of thinking maybe you guys should have had GORA obligate the funds because they seem to be able to obligate funds very quickly. Nothing further, Madam Chair. Sidus Masi.
Thank you, Senator Barnett. Senator Sabina Paris.
Thank you, Madam Chair, and good afternoon to the panel. Well, good morning still. And thank you for being here. And I guess the big question I have is, did anything change midstream as far as obligating ARPA funds? This goes to any of you on the panel.
Can you please clarify what you mean?
Yeah, okay, so in looking over the ARPA reports, it is clear that you've expended funds for ARPA. And so there was a process in place to expend funds. And so my question to GMH as well as to Director Byrne, did anything change, any rules change midstream in how funds are expended or obligated?
If I could respond to the overall issue, it was a fluid assessment. There was always reappropriation, reallocation of ARPA funds depending upon the need. And indeed, many senators, when we came to budget hearings and otherwise, would encourage the administration to spend ARPA funds on different projects. And, you know, from time to time, and some of those requests, they were acknowledged and actually actioned upon. So it was a continuous, fluid assessment depending upon the needs, both capital and operational, that transpired during the 3 years that ARPA funds were operational. And as you already heard, a large proportion, and 53 million is just under 10% of the total original ARPA fund receipts, were actually transferred to GMH.
If I can interject, the question was more to the process than to what projects can be used. It can be used for. So my question is, did the rules change in how money can be spent, not the projects themselves?
As I responded to Senator Duenas, there were a large number of documents that were issued by Treasury which either changed or modified some of the rules. Generally, they made it easier to spend, not more difficult, but from time to time, there were rules that came out that restricted how those funds should be spent.
What was the last guidance that was given? And would you say that did it make it easier to obligate the funds for GMH?
I don't think it made a whole lot of difference for GMH because the main thrust of ARPA was improvements in public health care. Some of the funds went to them for that very reason. So I don't think there was any restriction on using it on healthcare, and GMH is obviously a large element of that.
Thank you. And so this is for GMH. Is it your understanding that any guidance that came from the federal government, that was it ever, first of all, communicated to you? And was it your understanding that the process in which you were used to expending ARPA funds was the same that you used in the tail end of the 2024? Was there any communication in regards to rule changes and how to spend the money, how to obligate it any differently than you had in the past?
No, ma'am.
Okay, there was nothing that you knew or that was communicated to you that it would be more difficult to obligate the funds than you had in the past?
That's correct.
And did you receive a satisfactory answer as to why the funds were rejected? What kind of answer did you receive on why you cannot obligate those funds for capital improvement projects, which is so essential to the health of our community?
It wasn't that it was rejected, if I may just clarify. As Mr. Byrne mentioned earlier, there was that meeting in November of all cabinet members. And so those agencies who did not think that they would use the ARPA funds that they were allotted, to submit that. We didn't submit because my understanding is that we are going to use the 20 million that we were allotted, we were committed to use for CIP. So I did not submit anything to say that we're not going to use the 20 million. So, but again, that was the communication back then in November. So we were going with the understanding that we have that December 31st deadline to obligate.
Is there an opportunity to still obligate these funds?
My understanding is no.
I think they've been obligated elsewhere, and we are past the December 31st deadline. So I don't. There's very specific things in the CFR about how and when you can reprogram funds, and at this point, I think it's absent some major change in a program, I think we've passed the deadline.
Director Byrne, yeah, I was going to ask you, is there any thresholds, triggers that say, okay, because a hospital's not built at this time, GMH can use it for refurbishing their hospital because this is the only public hospital that's serving Guam?
The whole thrust and the whole origin of why we're sitting here today is that the ARPA funds had to be obligated by December 31st, 2024 by statute. There are some small areas where there could be some changes to that. For instance, there's a provision in the ARPA funding whereby if you employ somebody and you used ARPA funds to pay that employee, you can continue to do so after December 2024 until December 2026. However, the Treasury recognizes that you may not retain that employee for 2 years. So there are some very specific circumstances where it would be possible to reprogram, as you asked, but they're very, very few in number.
Okay, another thing I noticed in looking at the ARPA reports from December to January, a lot of the funds were shuffled to vendor payments. So can somebody explain to me the rules that allow such quick reallocation to vendor payments versus ensuring that it stays with the CIP project?
Director Byrne, you can chime in here and correct me if there's something. There's several ways to obligate, and one of the obligation categories was loss in operational revenue. So what had happened then at the end of December was the decision was made to reprogram $10 million into the loss of operational revenue because we had the financial audit for GMHA was released, which showed a drop of $10 million in operational revenue. So that's how the $10 million was reobligated. That $10 million was reobligated into that category.
Thank
So
you,
the question
Senator
I- the
Perez.
question I- okay.
Thank you, Senator Perez.
Thank you.
Senator Tello, Taitagui.
Thank you, Madam Chair, and good afternoon to everyone. Thank you for being here. Of the 20 million of ARPA funds that was, given to GMH, you mentioned there was, you spent about 10 million of that 20, correct? Is that correct?
10 million was used to pay operational costs.
Okay, for them, operational. Was any of it for capital improvement?
I don't actually know what.
I'm asking the hospital
details are.
actually, because they're, can I have accounting and the hospital ask that? Did you use any of the 10 million that you did spend on any capital improvements or any improvements to the hospital?
There might have been some.
There might have been some.
Yes.
Okay, so that's why it's kind of confusing. Then what did the difference on the requirements for ARPA funds that you needed to follow? Because earlier you said, Lillian, that you used these funds and realized that you had to go back because there's documents that you forgot to include. Now, that if you ask me, procurement is procurement. Whether it's ARPA funds or Government of Guam funds or federal funds, there is a process. So why all of a sudden there was a different process when you already used 10 million of that ARPA funds to do even some of the capital improvements as well as operating? So I don't understand what the excuse was.
Some of those vendors that needed to be paid by that 10 million were vendors, contractors, for some of our capital improvement projects that had already been started. So we needed to pay.
But you knew the process, because just earlier you're saying that the reason why you couldn't get this obligated in time because of the extra requirement or the requirements needed, but you already spent 10 million of the 20 and followed a process. So that excuse is moot. It's just, you made the mistake. And regardless, like Senator Barnett said, I'm sorry, but the people of Guam are not going to sit here and saying, oh, let's not blame. There is somebody that needs to be blamed for this. And I appreciate you bringing it up and saying that it is your fault. So we know that you didn't need additional documents because you followed the same procurement. So now that $10 million, can you tell me that you lost? And by the way, Mr. Burns, I'm hearing from other agencies that money was taken away from, they were given ARP funding and then they just took it away with no excuse at all. It's almost like a hidden agenda for this administration to just take back ARP funding that is needed, desperately needed, not only for the Guam Memorial Hospital, but other agencies for another project. So for us to sit here and say why it's being taken, I think we all know why it's being taken, and it's very unfortunate. Because what would trigger receivership over Guam Memorial Hospital right now if we cannot take care of our current hospital? We can go into receivership. Is that what we're waiting for? Of the $10 million that you lost in ARP funding, what was that supposed to pay for?
It was to pay for the 6 critical.
Can you please talk into the mic? I have
Sorry.
hard hearing. Sorry. Thank you
was
so much.
To pay for the 6 critical projects, the GMH air handling units, so this is the 40 units, the 450-ton chillers, the 265-ton chiller, this is for the roof and envelope, and then for the center island parking and the automated medication dispensing system.
So, Lillian, since you have it all listed and what's needed to be done, have you asked the governor to use her transfer authority to give you that $10 million to pay for these projects?
I certainly could use that as an option for funding source, but transfer authority, I think there's a
She has, well, Mr. Burns can tell you about that. The governor has a transfer authority when it comes to funding in the government to take from other areas.
Not between primary government and component units.
I'm sorry, sir, can you please, again?
Not between the primary government and component units. There's no transfer authority outside the primary government.
The governor has, we put it in the budget bill that she has transfer authority, right, within the government, right?
But not to component units like GMH. It has to be within line agencies.
But she oversees the hospital.
Well,
organically, she oversees by the Organic Act of Guam. So I don't understand why that's not possible.
Well,
I mean, you have an attorney from Guam Memorial. Maybe he can look into it.
We need to revisit the wording, but that's what it says.
Okay, well, let's revisit that wording, because Guam Memorial needs that funding and needs a whole lot more than just the 10 million that they lost currently. So, like I said, what's going to trigger receivership? My last question, Madam Chair, is can you answer that question, either your legal team or Lillian? What would trigger receivership for our Guam Memorial Hospital? The current one.
Receivership is a federal receivership, so it's typically something that's brought by the federal government. At this time, I don't think there's a bunch of factors, and it's a case-specific thing. I don't think that a federal receivership is appropriate, given the circumstances.
I didn't ask for your opinion. I asked you for what would trigger it.
It is a case-by-case analysis based on the conditions of a particular agency or program
It's based on the infrastructure of a building and the safety and well-being of those employed, correct?
Those are some of the factors.
And the inability to pay its vendors and provide the services that are required by law from this Guam Memorial Hospital, that anyone who walks into that hospital must be seen, correct? Okay.
Thank you, Senator.
Thank you, Madam Chair.
Thank you. We're going to move on in our agenda. Thank you, GMH, and for your testimony and your presentation. We're going to move on to the construction of a new hospital. If we could have Gora come to the table, please. Vince, Melanie.
Thank you.
Mr. Byrne, you can continue to sit at the table, please. Starting from my left, if you could please introduce yourself.
Hafide Fernando Esteves, Deputy Director, Guam Housing and Urban Renewal Authority.
Buenas, I'm Liz Napoli, the Executive Director of the Guam Housing and Urban Renewal Authority.
Hafide Mel Mendiola, Administrator, Guam Economic Development Authority.
Good afternoon, Senators. Vince Ariola, DPW Director.
Edward Byrne, Director of Administration.
Mr. Fernandez, if you'd like to begin.
Actually, I'll defer to the Executive Director to present for GURA initially.
Okay. Ms. Napoli.
We're proceeding then to the land acquisition status, right? Okay, so GURA purchased lot number 5280-3 in Manila, Guam for $3.5 million on November 4th, 2024. And then in October 2024, GURA made 3 offers to purchase 5 lots, lot numbers 5327-4-R5, 5327-4-2, 5327-4-3, 5327-4-4, and 5327-4-5 from Hong Yi Tan Inc. at their appraised values that totaled $2,683,000 plus 10% and a 1-acre property reservation. The third and final offer expired without acceptance by Hong Yi Tan Inc. GURA concurrently made 3 offers to purchase 2 lots, lot numbers 5328-REM-R2 and 5328-REM-2 from Joel Joseph at the appraised values of $3,970,000 plus 10% and a property reservation of 0.60 acre, a light industrial zoned with Route 15 frontage. And Mr. Joseph did not accept the offer. So GURA filed a complaint in condemnation against both aforementioned property owners on December 18, 2024, and tendered $6,653,000 to the clerk of the court for deposit. Defendants responded in opposition to the complaints, and both complaints are pending the judge's decision. So that's where we're at with respect to the land acquisition. We had other lots that we were looking at. There is one. This one? Yes, there is another lot, lot 5289-3. Oh, I'm sorry, 5297, which is pending that we are going to be purchasing for $1,210,000, and so that is pending. But that is the status of land acquisitions thus far.
Where's that land? Whose land is that?
I'm sorry?
You said you were pending.
Yeah, there is one other lot that is pending. The property owners do want to sell the property, but it's pending court. It has to go through the court. So there's one more lot that's going through the court, but they are wanting to sell the property. It's lot 5297.
Also, Mangilao, this is separate and apart from the eminent domain issue, and yes, this also being used through what funding source?
Yeah, I'm going to defer to Fernando because I'm having some hearing issues.
Okay.
Lot 5297 was on the priority list when we presented to the Board of Commissioners meeting on November 26th. It was in active negotiation at the time. We had a signed purchase agreement, but it is an estate, and so it's just pending court approval to authorize the sale. But the money has been obligated through a promissory note agreement consistent with ARP. So it's part of the obligation that was provided to GURA as the total loan sum amount. It's about 14.2 acres. It's fairly square, one single lot, and sits directly north of lots 53274-R5 and the corresponding smaller lots, all owned by the Hong-Yi-Tien Corporation, that is pending eminent domain, which would make up a total of 52 acres for the primary hospital location on the medical campus. So all the properties together make up the medical campus with the intended or proposed location for the hospital itself on the 52-acre combined parcel of 5327-4-R5 and the sublots, and 5297 that is pending approval of that sale.
Is there anything else that you want to share from GURA?
Yeah, I know we're thankful to the chairwoman for understanding we do have HUD folks here, so we do want to be able to answer any questions from the committee and other members before we leave. But to address the sinkhole, because there has been a lot of maybe misunderstanding and different information. The hospital is not going over the lot 5280-3, where 3 sinkholes have been identified. Now, after the geological surveys, which are part and already encumbered as part of the ARP, and this is from the community aspect or community planning part that we've passed over. So we did the land acquisition and prepared for a full NEPA. And we provide all that information to Gita and Adaloop so that they can formulate that into the actual hard obligation of ARP funds. But the 5280-3 is not intended for the actual hospital. It is part of the campus, and it could facilitate parks, smaller structures, either single or double. But the main superstructure of the hospital is intended to be on between 5327-4-R5 and 5297, which are adjoined, for making up a total of 52 acres, sitting at a little bit above 300 meters above sea level, meters above sea level. So according to LIDAR and topo, there's no sinkholes or at this point any reason to be concerned about the putting the superstructure there. Subject to your questions, I believe that's all we have. Yeah.
Melanie.
Hafden, good afternoon, everyone. I'm Melanie Mendiola, the administrator at GITA. I didn't prepare anything formal, so I'll just kind of go down the list of queries that you provided on January 27, 2025, if that works for you, Madam Chair. Okay. So the first thing I wanted to point out was, especially to the new senators, welcome, is we do have a website with much of what I'll reference today, guammedicalcampus.com, and I encourage you to take a look. A lot of the documents, so the documents I'll be referencing today are under updates, and it's the medical action plan, needs assessment, and so on and so forth. And so I welcome you to take a look. It's really it's super fun. It's like 600 pages in multiple attachments. So let me see. So I wanted to, let me see. So from number 3, new hospital plans and timelines. Progress to date for the construction and operation of a new hospital. So I'd like to thank, of course, the GURA team for giving the update on the land. With regard to the infrastructure, infrastructure funding, as you were made aware, have been made aware thus far, was allocated through the interagency grant agreement between DOA and GITA. So what we're doing is we're working now with the utility agencies who are, there are some subaward terms that we're looking at to outline the necessary infrastructure needs for the hospital. The amounts that are currently obligated are power, about 35 million, water, 26 million, wastewater, 36.7 million, 36.8 million, engineering fees of 5.5, and of course our fees for our staffing and any other sort of subcontracts and such that GITA hires to assist with the project, for a total amount of approximately for 104.8 million. Once completed, we will begin the initial phase of the project, including the design and construction, as well as we're also working with the Office of the Governor. So at this Community Defense Liaison Office, there is an engineer there on staff, and so he is leading the cavalry with regard to planning for the environmental, archaeological, physical, geological, those types of studies, and so on. The next point that you brought up, transition plans from the current GMH to the new facility, I defer that to the Guam Memorial Hospital. We're not involved in the transition. Plans on the existing GMH facility once the new hospital is operational, that is available in the Guam Facility Reuse White Paper from 2022. So the white paper for the adaptive reuse and development of government facilities was focused on GMH and the old public health in Manilao. GMH was identified for adaptive reuse that can support a variety of community needs, including a central location for DPHSS. As you're well aware, they rent public health rents all over the island at the current time, so to centralize them here in the interim for maybe a long-term plan to house them at the medical campus is a possible reuse, or expansion opportunities for Guam Behavioral Health and Wellness, GBWIC, Guam Behavioral Health. If you have visited GMH in the last 3 months or so, you'll see that Guam Behavioral's parking has kind of bled into GMH, so they're kind of fighting over parking. I know when I had to go to GMH to visit a loved one, I was you know, parking at Guam Behavioral and praying that I didn't get a ticket. There are other consolidated administration facilities or ancillary medically related functions. Right now, the Guam Memorial Hospital is utilized 24/7. It's a hard use type of situation. So one of the things that was identified in the 2022 white paper was perhaps if it's adapted to not so hard use, something a little more administrative in nature, that might be better before it's completely unusable and yeah, and then we go from there. Updates on design, groundbreaking, and RFP. The focus is on preliminary site preparations to include rezoning, registration of land, and recordation, surveying, and permitting. This phase also includes NEPA, National Environmental Policy Act, which is not required under ARP. However, because because we're being proactive about seeking multiple sources of federal funding, anytime you utilize federal funding, it's a given that you got to have a NEPA done. So we're going to go ahead and get started on that process in anticipation of additional federal funding. Once all site preparations are underway, it looks like we'll be able to do an RFP for A&E and proceed from there. Land acquisition status, my colleagues spoke to that. Financing, as you're well aware, Gita is the central financial manager for the government of Guam. There's not a whole lot of changes with regard to the ability to go out for financing. This was contemplated under the healthcare, under Public Law 36-56. In 2021, the legislature authorized $35 million in the 21st Century Healthcare Facility Act, which authorizes terms of up to 7% for up to 40 years, with an aggregate not to exceed $600 million. And to minimize costs to the government, it also authorizes lease financing and tax-exempt or taxable bonds or loans. And so with that, 40 years is the buzzword. Usually if you're going after something, or it's the buzz term, if you're going after something like USDA for a loan. USDA loans can go for up to 40 years. The current interest rate on them is 4%, but the max you can go after is about $100 million. So if we have a $500 million or $600 million hospital, what we would do is probably get the first or the last $100 million, depending on the timing, from USDA, and then the remainder through a bond. And so the bond would only go out 30 years, is typical, whereas the USDA loan would go out 40 years. And the estimated rate at this, if we were to go out to the market today, is about 4.89. If you've been watching the news or monitoring what's been going on with interest rates, or if you're in the market to buy a house, you see we're in kind of high interest rate environment relative to what we're used to. 3 years ago, you could get a home mortgage for like 3.5%. Now it's like 7%. We're all freaking out, right? So the municipal bond market, though, is a little different. It is higher than it probably would have been if we had started building 2 years ago. Having said that, Guam is still, we remain the crown jewel in the territories for our financial health versus other islands like Puerto Rico or the Northern Marianas. We have more liquidity and more solvency. And so we believe that if we were to go out to the market, we'd still be in a good position to do that. Projected costs for the new hospital, infrastructure, I articulated that earlier. Infrastructure, water, wastewater, all of which would total about $100 million. Usually A&E is about 10% of the total design of the building. If you all recall, the first time we got the cost of replacement was from the Army Corps of Engineers in a 2020 study. That was $700 million, $750 or so. And then when we looked at a cost of replacement excluding infrastructure, it was like $500 million or so. The $1 billion price tag that was running around, if you recall, that was for the CDC, the lab, which is already being constructed elsewhere in Manila, so that's off the tab, as well as public health and Guam behavioral, which is all contemplated in future phases. So the first phase is probably like a $500 to $600 million price tag with, of course, the obvious inflationary adjustments that we've experienced in construction over the last couple of years. So just a recent example, I was reading School of Engineering at the University of Guam, was about, I don't know, sub $1,000 a square foot. So if we kind of attach that to this price tag, it's about $563 million a square foot. Now, having said that, the UOG, remember that site was ready to rock and roll, right? This site is still being prepped, but that's why the governor is using the ARP for the prep work. And then, of course, we continue to look at financing options. We're very interested in potentially going after a community development block grant. We're also very interested in partnerships with the Department of Defense. One of the things I did not mention is the cost of road widening, and of course my colleague Vince can probably talk more to that, but road widening, we've been looking at expanding Route 15 to 6 lanes, but this isn't an idea that's contemplated by the hospital. This was an idea contemplated by the DOD when they widened it, I don't know, 20-some years ago when I was in college. Oh boy, I shouldn't have said that. Well, 6 years ago, so the telephone poles, you know, it accommodates 6 lanes. You don't have to get any more land for the road. And so we believe that there are good nexus, there's good partnerships with the DOD in a variety of fronts. The road widening portion with DP, you know, I don't believe it's currently on the defense access roads list, Route 15. However, if you go back to the history of defense of the Marianas, Route 15, it's called, I've been living there my whole life, it's called Back Road. You know why it's called Back Road? Because the main road is Route 1, right, Marine Corps Drive. It's the back road because it connects Anderson Air Force Base to Naval Hospital. So it's not on the defense access road list, but that's something we're actively working towards changing. So that would address any kind of traffic issues that the residents, the good residents of Manila would be dealing with. I'm trying to think of anything else that I might be missing. Oh, other DOD partnerships. When we were talking Eagles Field, we had talked about partnerships regarding a hyperbaric chamber, helipad, or even a multiple casualty MASH capabilities. They're called multiple casualty capabilities of the hospital at that point in time. And those are still on the table, though not actively being kind of pursued at this juncture because we're still prepping the site, right? So that's what I have. Other items, ma'am, so infrastructure mitigation of sinkholes was addressed, design construction. FF&E, 69 million. I want to say that's on the GMH Needs Assessment Report, page 3. Technology, OTEC has been involved since the first medical action plan. We were talking about maybe putting like we said maybe the sinkholes would be a good place for data storage because underground is cold and you need that, but that's a separate discussion. Legal fees, we think there's enough lawyers between the multiple agencies to handle the legal fees, so we don't expect anything extraneous with the exception of if there's litigation at some point. And additional anticipated costs, not at the moment, ma'am. And so that's, I welcome any questions you have. Gita is by and large, not a bystander per se, but we try to help administer the project in any way that we can and try to uncover all the different options. We don't always have the answers, but we can certainly endeavor to find the answers if you have them.
I'll get to some of the questions after I hear from everybody on the panel. Vince?
Good afternoon, Senators. For the record, my name is Vince Ariola. I'm the Director at the Department of Public Works. Our involvement here is basically, as my colleague Melly mentioned, would be the access, the ingress and egress in that area, which is basically identified as Route 15. As you know, I believe I mentioned it in one hearing a while ago, when the hospital was first planned for Eagles Field. We were asked to do a conceptual design of expanding the Route 15, and that would be the intersection of Route 10 and Route 15 around Price Elementary School, all the way past, I think we took it past GPA, a little bit past GPA. There's maybe another half a mile past there. And the conceptual design basically took Route 15 and turned it into actually a 5-lane highway, 2 going east, 2 going west, and then a middle turn lane. It also included a couple traffic signals around the hospital area. We didn't take it all the way to either Waisengsong and Jigo or all the way to the back gate of Anderson. But with the ramping up and the increased expansion of the military buildup, we are looking at trying to get that, as Melanie said, trying to get that on the DAR radar, so that we believe we can get additional funding for that based on the existing military buildup. To do that, we have to do a lot of planning, we have to do a lot of traffic studies, we have to do a lot of research to show that that road will in fact be impacted, as well as is Marine Drive getting impacted by the increased military buildup here in Guam. I think it's a great corridor to consider as an additional thoroughfare that basically parallels Marine Drive toward Anderson. So we're looking at that. Initially, when we did the conceptual design, again, it was a very conceptual design for the expansion of the road. The initial estimates that came up to include design, construction management, and construction was about $50 million, and that was about 2.5 years ago. We are getting that design updated, the numbers updated. We're probably going to do like a phase 1, if you will, 2 phases. One phase that will accommodate the hospital and increase residential, perhaps commercial buildup in that area. And it'll take it a little bit past GPA, basically in between GPA and Hawaiian Rock. And then the phase 2, we'd like to take that all the way to Anderson. And the reason for that is really it's a funding issue. Now, if we're very successful in landing the full amount to take it all the way to the back gate of Anderson, or at least Waisengsong in Jigo, certainly we'll take that and we'll move on that. But that's basically our involvement with expanding the highway, the road, and Route 15. And there's plenty of easement there. As my understanding is there's a 100-foot easement all the way through to the back gate of Anderson. There may be portions that might be 80, but the last we looked it looked like 100 feet all the way through. So there's a lot of room there. The only involvement that DPW would have would be on the permitting side. That we'll take a look at based on whatever designs, plans, specifications come forward. But that's really the involvement of DPW. Thank you, Madam Chair.
Mr. Byrne.
Thank you, Madam Chairman. DOA is obviously concerned with financing. We look forward to working with GIDA on the structure for financing for this whole project. Project financing is really something that is kind of exciting to an accountant, because you're using your skills to make something happen. And hopefully at the end of all this, out of the ground will come a new hospital that's being paid for in a economic way. As far as the ARPA funds, part of this is concerned, DOA, initially, of course, the ideal thing would have been to have spent the ARPA funds, and then we wouldn't have been involved in this exercise of obligating them. Unfortunately, because of the delay and the statutory deadline imposed by the ARPA legislation, that we got into having to obligate them rather than spend them. If we'd have started a year earlier, some of the costs that the GIDA administrator we're talking about would have been already spent.
Thank you, Mr. Byrne. I guess we'll proceed with questions, and I guess I'll start with you, Mr. Byrne. You were talked about the ARPA funds, ARPA money being obligated. So how much total in ARPA money has been obligated toward the construction of the new hospital, aside from the 9.1 million mentioned earlier?
Well, the 9.1 was subsumed into the amount that's allocated, which is 104.8 million, as Ms. Mendiola just commented.
So it's a total of
104.8?
From ARPA funds moved to?
Yes, that's correct, ma'am.
Okay, sorry, I didn't have your presentation or anything in writing, so and it's kind of hard to hear what you're saying because you speak really, really fast. So a total of 104 million ARPA money. What I didn't hear, and maybe you did say it.
35.5, ma'am, for power. 26.1 for water. Wastewater is 36.7. GITA, administrative, 1 million. Environmental engineering, 5.5 million. This is also found on the GovGuam, the interagency agreement, which I believe is on the Office of the Governor's website, and it's also on our GuamMedicalCampus.com website.
And how much total are we looking at for the construction of this new hospital? Some are saying 1 billion, some are saying 2 billion.
Right. I don't know where the 2 billion number came from, but just to take you back a little bit. So the Army Corps of Engineers, when they did an analysis of a repair versus replace, the repair was, I never get this right, 761 million is what the Army Corps proposed as a replacement cost. A 300-bed hospital would be approximately 930,000 square feet. This is not, a replacement of GMH would be at about 160 beds. No.
Lillian, you could come up to the table, please.
The replacement of the hospital, of the current GMH, I think GMH has something like 160 beds by our last count. And so replacement would reduce that square footage by 300,000 or so. So 500 and, I remember doing the calculation on this, about 540,000 square feet, I think is what we'd be looking at. That is, and that, ma'am, is on the, let me see here. That can be found as well on the medical action plan, project overview, medical campus master plan, project overview, section 1, page 5. So it could be 840,000 square feet for a 300-bed capable hospital. This is not a replacement of GMH is not 300 beds. It's like 161 beds. 161 beds would bring down the square footage to 500,000 some. And then what I said was that the most recent that I looked at was the School of Engineering at the University of Guam. I think that came in at about $1,000 a square foot. So I think that it'll probably be, for the 161-bed hospital, probably about 700 million, 600 to 800 million perhaps. But it really depends. I mean, you know, what we want is a replacement, and if you decide that and it also depends on what's being covered. It depends on the site and how complex you want to be. So, for example, I think there was also an article I was reading about the military where they said it's going to cost $3 million to construct a 4,000 square foot home, and the first thing I think I read was like, what military family needs a 4,000 square foot home? That's crazy. But then the article went further to say a lot of that is because of soil remediation, because of contaminated soil up at the Anderson Air Force Base. You know, and they listed all these environmental things. Now, we're trying to get all that out of the way with the ARP money that we have now, such that the only thing we're paying for is the literal build. but we won't have a better number about what that hospital replacement cost will look like until we've got our site ready to rock and roll and we put out an A&E for it. An RFP for A&E.
Yeah, the reason why I'm asking about the $1 billion is because when I was at Adelup for the briefing from the various government agencies under my oversight, I was presented this CIP 5-year listing as of January 9th, 2025. And it did say that the new hospital will cost about $1 billion, $800 million for the construction, $200 million for equipment, and $80 million for technology. So if you're not sure about, how big the hospital is going to be, the location, then how would you come up with this $1 billion?
That was based on the Army Corps of Engineers and I don't know where the FF&E that's listed in the medical action plan is $69.1 million. And that's furniture, fixtures, and equipment. I don't know what the Office of Technologies, I don't know what kind of servers or e-health records we're going to have in the hospital. But the $1 billion the initial go, the first time it was, I believe at a previous hearing when we were adding it up to $1 billion, it was because it was inclusive of the hospital replacement in addition to the Guam Public Health as well as the Guam Behavioral Health, and it was a square footage calc. It was straight square footage. How much square footage does public health occupy throughout the island? How much square footage does Guam Behavioral Health occupy throughout the island? Multiplying that times the cost of building, that's how we came up with the $1 billion-ish 4 years ago, 3 years ago.
Fernando or Ms. Napoli, I wanted to ask about, there's a recent article in the paper about the governor wanting to use $400 million in the Community Development Block Grant disaster recovery funding that is available or will become available. Is that something that she can say, I want to use the $400 million, and boom, she's going to get $400 million for the new hospital?
So if I may,
and is it really eligible?
Well, if I may,
sure.
The HUD officials that we're meeting with today came since yesterday, and they are here from the Disaster Recovery Office in San Francisco, specifically to do TA for our GURA team on the disaster recovery. Technical assistance on the disaster recovery funds and the administration of those funds. There are a lot of rules and regulations that have to be followed, and also eligibility criteria for that meet the national, national objectives, right? And so there are different phases for the Community Development Block Grant Disaster Recovery, and we're going to be going through the first phase, which is coming up with an action plan in 90 days, and then there'll be the phase 2, which will have to do with the financials, and then the phase 3, which will be, towards the completion of the use of those funds. But I just wanted to lead in to say that we have designated Fernando to be the lead person on the oversight of the Community Development Block Grant disaster recovery funding. There is a lot that goes into it, and so I will defer to him because he might be able to answer a little bit of the specific questions that we've learned so far from what the HUD officials went through with us on a quick overview yesterday.
Thank you for the question, Madam Chair. So I'd like to start off with the short answer, no. No. But it's important to have the context. The guidance, the universal notice that went out that provided guidance on how these funds are to be used, how it's supposed to be broken down, what the rules and regulations are applicable to it, that came out January 21st. GURA held its housing summit on January 27th. We were still actively reviewing it when the media ambushed the governor at the housing summit and asked her a question, truthfully, before we even had a time to finish the review and advise her. So I think it's unfortunate that, hopefully, thank you for the opportunity to clear the air on that statement that was made, but the answer is no. And so we've since had the opportunity to sit with the governor and go over what we've taken that 500-page guidance down to about 4 slides when we start doing the public engagement. Went over that with her. And we've had an opportunity to go over it with the HUD folks too as well. And part of the TA is to ensure that our interpretation of the guidance and the universal notice they put out, literally the writers of the notice, one of them is here, ensuring that our interpretation is accurate. And so far, yes. So we have a clear understanding. There's a synergy and between us and the ODR, Office of Disaster Recovery with HUD. We've made that clarification, had the opportunity to make that clarification and do our job to properly advise her. Unfortunately, as I said, we were getting ready for the summit and just didn't have that physical opportunity to get in front of her and give her that update.
For clarification, can this funding be used to build, this disaster recovery funding be used to construct a new hospital?
It can be put towards efforts of a new hospital. Hospitals in general are an eligible Title I project. Now, again, and I'm going to go with the HUD ODR answer throughout because of my understanding of the guidance and their understanding and their writing of the guidance. A yes or no isn't going to come till the actual application is submitted and it's vetted to ensure that it's compliant with the rules, the outline, and everything is vetted. That all is part of the action plan preparation, which is ultimately approved by HUD or turned back to correct.
What about the Guam Memorial Hospital? Repairs, renovations, are they eligible to apply based on what you've read on the universal notice?
Yes, stakeholders are all eligible to contribute towards the unmet needs assessment, which will help determine what the priorities are going to be. And also we'll be comparing that to other data sources. But yes, in terms of straight eligibility, if it meets other eligibility requirements, money towards a hospital, either the preservation, repair, replacement, new construction, all fall in that category of hospital under Title I.
And Lillian, is that something that you guys have your eyes on, you're tracking, plan on putting in application?
Yes, ma'am, and we even spoke to the governor about it yesterday, and we just spoke to Fernando this morning, and so he's going to be calling a stakeholders meeting soon that GMH will be a part of.
And how much are you guys looking to apply for? Is that how it works?
Yeah, that'll come. So when we do the action plan, it's a really top-level budget, right? So as information comes in from the stakeholder engagements and public engagements, we do that initial budget in the action plan based on supporting data, what the priorities are going to be. So that's real top-level pots of money. Then if they approve that action plan, then there's the programmatic portion where the actual application for project funding comes in, and that's where the deeper vetting comes to play.
During the housing symposium summit that Gora held, there was a presentation by FHA. Melanie, or even Fernando or Mr. Byrne, is this a funding instrument that the government will be pursuing to help fund the new hospital?
Yes, thank you for that question. I haven't fully reviewed the requirements or the parameters of the FHA program. What we tend to find with many federal programs is, for some of them, the capacity is limited. So for example, USDA, they have their top line limit at about 100 million. So it depends on what the funding capacity is. It also depends on the intermediary requirements. So for example, U.S. Economic Development Administration, they gave a grant to the University of Guam for the building of the water lab, as well, the WERI lab, as well as the School of Health expansion. It required an interim lender, so if there's an interim lender requirement. So those are the sorts of things that we usually vet before we say definitively, yes, this is a good route for us, or no.
Mm-hmm. You know, as I was preparing for this informational briefing, I was kind of going through some of the laws and some of the past hearings that have been held regarding the new hospital. So in one thing that I read, Guam Law 12 GCA Chapter 83, the Guam 21st Century Healthcare Center Act of 2021, it references a detailed reuse study regarding the existing Guam Memorial Hospital. And it did cite GITA, and I know earlier you mentioned that you weren't really involved with that, but it does state that GITA is in fact involved in providing this reuse study.
Madam Chair, that is in the Guam Medical Campus website. Mm-hmm. It's called the Guam Facility Reuse White Paper 2022.
Mm-hmm. So where are you guys in doing this study? Is there anything completed?
Yep. Well, the white paper's there, but there was no, there was not a priority, I believe, at the level of funding that we had for the medical action plan. It was probably pushed towards the back, and so we had got the white paper. If there was anything more extensive we wanted to do, we could certainly look at assigning resources accordingly, ma'am.
Okay, so you haven't begun doing this study?
No, the facility reuse white paper is done. So per the I guess if you want a more in-depth study, we're happy to begin that study. We have not begun that.
Okay. Do you have any idea what we might be reusing the Guam Memorial Hospital once this new hospital is completed, wherever the location may be?
Well, on the facility reuse white paper, it primarily recommended for use of government facilities for other medical service providers. I do think at the time of the transition, it should be assessed as to what extent the Guam Memorial Hospital is usable, you know, all parts are usable for different types of applications.
What is the backup plan should the Attorney General win his lawsuit?
Can you be more specific, Madam Chair?
The two lawsuits that are going through the court regarding the potential violations of the open government law and the other lawsuit, I believe, related to eminent domain?
Yeah, absolutely. I can speak to in a general sense because it is pending litigation, but I have zero concern. As a matter of legal opinions, if every lawyer agreed, there wouldn't be the need for the courts. But I am fully confident in our due diligence and the due diligence of our agency and organization. Speaking again generally, there's more than 40 years of precedent that has said, and all of the public infrastructure GURA has built from all the senior centers, based on the same law and statute relied on for our activities today. There's no doubt in my mind that that is established and that every single public facility we've constructed under the housing project statute is legal. And so, yeah, there's zero worry on our part. Zero. Thank you.
I'm going to go ahead and allow some of my other colleagues to ask questions because I think I have plenty more, but Vice Speaker Ada.
Thank you, Madam Chair. Melanie, you mentioned about the public law that exceeds to borrow, that allows to borrow up to, I believe it was 600 million, you said?
It pledges 35 million set aside for up to 40 years, sir.
Okay, so we're not supposed to exceed, what was the cap, not to exceed?
Not to exceed 600 million.
600 million? So the hospital is going to cost over 600 million. Does this law need to be revisited in order to authorize a higher cap?
I think it's premature to call that, but possibly.
Possibly?
As we've come back for many other government facilities.
Yeah, okay. I just wanted to get that clear so that in the event that it has to come back, that, you know, we're
That you're
expecting
ready.
it to come
Well,
back.
we will certainly keep you updated with the price estimates, sir.
Thank you. And over you were mentioning 5.5 million for, I guess, environmental services, 35.5 for power, 26 point some for water, 37 wastewater, and then 1 million admin. And you were saying that the main structure, that's what you were looking just to finance, is just the main structure of the facilities, right?
So I believe the medical action plan contemplated a multi-phase type of process. So phase one was the construction of the hospital facility itself. However, the upgrade of all of this infrastructure will deliver upgraded infrastructure that would accommodate the entirety of the medical campus, in addition to modernizing the power infrastructure, water and wastewater infrastructure on Route 15.
Okay, and then the roads, is that going to be an additional cost for the roads and things like that going into the medical complex?
If you go into the medical action plan, I believe the initial estimate for the widening of roads remember the medical action plan was contemplated with potentially like an Eagles Field site. This site is like right next door.
Okay.
And so at that time, the price tag on widening of the roads, I believe, was 26 million. So if that was not included in a defense access road type of, if there was no nexus between the DOD and the government of Guam on this, on the use of Route 15, then that could potentially be an additional borne cost. Yes, sir.
I see. And what would the debt service be on the total cost for the hospital, be it 600 million or 1.3 billion? Have you guys figured that out yet already?
Yes, sir.
Yes. And what would it be at 1 billion, 1.5 billion, 2 billion? What would the different debt services be? I mean, because I know we're looking, and you said that, you know, it could be upwards of 800 million or whatever it may be, but just to kind of give us a ballpark figure.
Let me see. So if 100 million if you could utilize 100 million from the USDA at a 40-year amortization, that is an annual payment of approximately $5 million. So we want to take the $5 million off the top because USDA will historically have the lower interest rate than potentially the bond market, right? That's the first thing. So that's 5 million, so now we have 30 million. If we're going out for a $30 million lease back, so that means we're not going out for a general obligation bond, which we currently do not have the capacity on our debt ceiling to accommodate. We go out for a lease back or PPP, whatever, then something like that would be another 300 and net of, so all of the schools here have an insurance and maintenance portion that's like 20%, 15 to 20%, so it's negotiated. That would take us out another maybe 300, 377, 300, that's it with the current rates. So let's say we go out for this bond in a year's time, we cross our fingers that the rates would go down by about 50 basis points. I think there's a prediction of one more drop in July, but it's still premature to tell because of all the, what's the fallout of the tariffs and all of that, the Trump policies. And then, yeah, there's a number of factors, sir, but I mean, if foreseeably it would be double, if you're looking at the current 35 million that would accommodate at the time, so 3 years ago when we were looking at the Healthcare Act, we were saying this amount 35 million should accommodate 600 million in capacity. Now we're saying this amount, 35 million, should accommodate maybe 500 million in capacity. Now if the rate moves closer to where it was 2 years ago, which we anticipate it would potentially do, then we're getting closer to 600 million, okay? And then, so if you're looking at a 1.2 billion facility, then foreseeably you'd have to double that.
Okay. That's what we're looking at, about 70 million for debt service.
If you had to finance the entirety of the hospital, which we're working towards not doing.
Not doing, okay, thank you. Fernando, you were mentioning about the ARP funds that you guys have and set aside, right? Are you guys compliant with all the rigid that you have to be with ensuring that none of those monies will go back? I mean,
Yes, absolutely. So there's two different components. The original allocation was more like a pre-approval, right? The actual document that obligated the funds was to be the mortgage. So for example, it says, Gura, here's, you've been approved or awarded or pre-approved for 10 million to go out and get a loan. This is the best way to explain it. And it's not a pre-approval, but it's the best way to explain in analogy. So we go out, search for the property, and when we come to an agreement, when there's escrow, DOA would be the ones to pay. And then the product comes out would be a mortgage where Gura would have the title, but would have a debt to DOA. The second part of that is, should we transfer it to the government of Guam, that will leave that debt as the example. Now, since we were coming up on the ARP deadline, right, we had to look at another obligation agreement that would be consistent with ARP, which was the promissory note, the existing loan we have on the property we've already bought, and then all the evidence showing that what those amounts are, how the obligation came to be, why we're now committed to that payment. So there's two different parts to it. One is our obligation to the grantee, which is the government of Guam, Adelup, with the mortgages and promissory notes and the general agreement, right? The MOU. So we have like 3 different agreements all for the various pots that we have. And that outlines all of the requirements and stipulations. For the most part, the general requirements are 2 CFR 200, which is consistent with the normal federal grants that we have, but of course they included the ARP specific requirements, which we were well aware of, and those were all signed and obligated before December 31st.
okay, so bottom line, you guys are just in compliance with all the rules?
Yes.
Okay, thank you.
Thank you, Senator Ada. Senator Chris Duenas.
Madam Chair, and thank you once again to this panel. So I think the reason, and I'm glad for the hearing, Madam Chair, the speculation on the possible $2 billion has been floated because of a lot of discussion between whether or not we're talking about maybe a phase of the hospital first, or the concept of the whole shebang at one shot being the medical campus. So the reason why I asked that question is when I'm looking at the presentation that has kind of the footprint design concept, I'm going to ask this in basically 3 phases. Is this basically the new land acquisition that's underway? Is this basically taking the proposal from Eagles Field that was originally encompassed and relocating it to another 102 acres?
Senator, thank you so much and for allowing me to provide clarification. So in the spirit of transparency, I was just providing you my personal notes, right? So yes, it could easily be misunderstood. The original site of Eagles Field was 102, about 102, 104 acres. The reason you may see on that conceptual plan that carve out was to see if, based on the acquisitions that we did, just from a very broad, is how feasible would the site be if we were to look at this lot versus that lot. So when we look at combinations, right, what would be the actual hospital proper, what's going to be the ancillary facilities. So in that mock-up that you're looking was just my notes, and demonstrates that the hospital concept that was originally planned for in the matrix could fit without too much editing. But that's not to say that that's the final concept. It is going to be determined by the final completion and of the lots, the combination of those lots, and whatever environmental assessments come out from there, and the A&E design. But it's just to kind of show that we're not too far off from getting through that portion. Does that answer the question?
It does, okay. Because where I want to go next is, there was a lot of talk about the ability to secure funding outside of the local resources of the appropriation of 35 million by getting grants, different loan setups, a variety of different financial outlooks. Now, I'm just going to say what I've heard, a little bit of chatter maybe with regard to the federal government, particularly Naval Hospital, or even the military's involvement after Eagles Field was no longer on the table. Every time we hear this discussion of these partnerships, grants, financing mechanisms, everything else, is that based on the original discussion, or are there subsequent discussions now that you've gone forward in realizing another footprint of property?
I'm not part of those specific discussions, so I'll just make that clear. But I will say this from I guess an organization that relies pretty much in its entirety in federal funds. You won't get a commitment for any funding source until you are further along in any process. So GURA, as a grantee for potential projects, won't approve anything unless you have some kind of project cost estimate, some kind of site location picked out. I would believe that would be no different than any other federal entity or Congress if they're going to look at funding to provide for a specific project. So I hope that helps in the discussion.
It does, because it sounds to me like the answer is no, because there's nothing to ask for right now. And so my third question then will go to Public Works. So because it's on the list of questions, you have no ability to move forward on design at this point in time without having established site control and the design concepts of the acquisitions. Would I be correct in assuming that?
Yes, Senator, you would, similar to our federal highway construction projects. My colleague Fernando is correct. Before you even start on a project, you need to have fee simple ownership of the property. You need to have funding available for it. And then you get into all the requirements for clearance, NEPA. That's usually the big one. NEPA covers everything, right? Environmental issues. Then there's the design part where you got to look at the topography. Then you got to do boring tests. So there's a lot of issues that have to be covered.
So I'll stay with you, Vince. It's been widely reported in the media that there are ongoing discussions and meetings with CCU on infrastructure improvements, infrastructure area around this proposed new hospital, and their board contemplating, the CCU contemplating whether to proceed or not proceed based on commitments from funding sources. So would this be regardless of the plan, simply because you have control of the road and infrastructure laterals capability of doing the work?
No, I think, at least in the meetings that I've been in, this only involved GPA, the creation and the possible construction of a substation in that same area. So that's the extent of my knowledge there. And I understand that they would like to put the lines underground and connect it to a substation in Barrigada as well, so that there's continuity of service. I believe Ukadu, another substation somewhere on the way to Barrigada, the Barrigada substation, then connected up to the Miguelo site. Yeah.
So
thank you, Senator Duenas.
Okay, thank you, sorry.
Senator Taitegui.
Thank you, Madam Chair, and thank you for allowing me to go next. I do have another meeting I have to attend to. I just wanted to ask questions. Mel, the first time we looked at some kind of report was when we had the meetings that I think Lillian, you were the chair. This was back in the task force. And then in that task force, there was a printout, and it showed, and I guess the chair was mentioning how that amount of funding was in the billions, or well, 1 point, to be exact, it was, let me get that, I have it
1.1-ish.
1 million. Yep, it's, so GMH, during that time, now this was done in 2021, right? It was 817,300,000 just for Guam Memorial Hospital. And that was assuming a 10% escalation. So like, again, this was
a 10% escalation from the 760 some from the Army Corps.
So, and then of course you have public health, Guam behavioral wellness, and the infrastructure and other costs, et cetera, coming down to about 1,067,300,000. Now, that was 2021. And then you keep mentioning earlier about an action plan. Check the latest action plan. So I went on the governor's website to look at this action plan. And it's the matrix one that you're talking about, right? Okay.
Yes, ma'am.
Okay. And that action plan was actually created in 2022.
Correct.
So you had something in 2021 and then something in 2022. So my question is, do you have another plan, or we're following, when you keep referring to go back to the action plan, and let me pull that up, the matrix one that was created in 2022, is there another one that we need to look at?
No, we're waiting to settle on a site, ma'am.
Sorry?
We're waiting to settle on a site to then determine the steps forward, because the requirements of GMH will not change in 2023 versus 2022 with regard to the square footage of an OR, for example, or the emergency room. However, the cost to build could change depending on how complex the site is. So that's why we're held up at this point without a site.
You're held out without an update of the action plan?
No,
or?
an update, it would be probably an unwise use of resources to go back and update the action plan without a path forward as far as settling on a site.
Well, you do know certain things like how many beds that are going to be required based on today's population, based on the fact
versus
that
last year's population, ma'am?
Well, yeah.
Well, the population is updated every 10 years in the census, and so I think that from my recollection, when the Matrix was putting together this study, they were basing it off of things like they're doing it based on things like the census. However, in reference to your question, I think that's a very good observation, really with the perspective to workforce, because a hospital 3 years ago might not be as expensive. You might have a different workforce. The look of the workforce may have changed 4 years later in post-COVID and with the competition of labor with the military. So there are aspects of the study that could use updating, sure. That's a good observation.
Okay, so do you plan in like the next couple months to at least put another action plan together now that we have new information that's being provided from GURA, from DPW, and the opportunities that there are regarding, well, funding from the Fed? Because I went to by the way, the GURA had a great summit last week. Appreciate it, and knowing that there is an opportunity for infrastructure is important, which I hope stays for low-cost housing, for housing development. And then there was another opportunity for funding through another gentleman who came in and testified. So, there's a lot of variables now that are in place. And because of that, I think that, to put it on a report might make it a lot easier, so we don't keep redundantly asking the same questions over and over. How much does this cost? Just give us the PowerPoint
I will
presentation.
always be here for you, though, Senator. I will always be here to answer your questions.
Thank you so much. But, you're not here when we're studying at night or working on this. So I appreciate it if we can get an updated version that we can look on the action plan so that we know where we're going, or the intended direction that this administration wants to go. So that's basically all I have to ask, and looking forward to that updated version. Thank you, Madam Chair. And thank you, Mel. Thank you.
Thank you, Senator Taitakwi. Senator Terlahi?
Mr. Byrne, can you please explain the $104 million that's been obligated to the new hospital? How was that obligated?
Senator, I believe I already responded that it was through an interagency agreement.
Can you please explain it so everyone in Guam can understand? Because they haven't spent the money, have they?
No, as I just said, it would have been simpler had we spent the money. If we'd started earlier on this, then we wouldn't have had to go through this complex agreement. The agreement, and it's something that's set forth in the Treasury guidelines, and we actually used a model that was pioneered by the state of Colorado. It was required by Treasury that we obligate this, and one of the ways of doing that was through an interagency agreement.
So, yes, please explain. Who has the money, and what was it obligated for?
The money, the ARPA money, we've had, we got it in 2021.
104 million sitting in the bank.
Yes,
right?
plus the other unspent funds, yes. And there's an obligation between DOA, or GIDA is obligated to DOA to perform these duties, and as the cost is expended, DOA will pay out the funding.
So GIDA is obligated, so pretty much one of the government agencies entered into a contract with another government agency to spend all the money. They didn't have to spend it all. They didn't have to even issue purchase orders or anything more exact than that.
We followed the Treasury guideline.
Yeah, it's just sad, maybe, that you weren't able to find such a wonderful feat to pull off for GMH's current needs of even $10 million. So we put aside $100 million, and we're saying we're going to spend it on these things, but I'll just use one example. So we've got $104 million just kind of categorized for waste, 38 million, but for example, the engineering. So you say we have an estimated cost of $5.4 million for engineering. I think, Director Mendiola, if I understand, you said this engineering is being taken care of by one of the governor's offices?
No, ma'am. What I said was the CDLO, Community Defense Vera's office, employs an engineer to oversee the carrying out of these environmental projects, such as the soil survey, the topo, et cetera.
All right, so are there contracts for these listed engineering contracts?
For the, I would say from my knowledge of some of these, yes, there are, and for some there are not. So for example, GPA, I believe they have some designers on contract, but the build, they'd have to issue an IFB for the build for the substation.
Right, so they've only obligated like 750,000. They've given that to their engineer to do an assessment of how we can accommodate this hospital. But all the construction costs, all those contracts, all the contracts for these engineering projects, for example, to assess the sinkhole, to do the Historic Preservation Act requirements, the hydrological survey, all of this is money that's not yet like contracted.
Not all.
Right, and so again, I'm just so upset that why were you not able to do such a thing for the GMH's current needs where they were so close to procuring these items? It's like we're just setting this money aside. We're saying that GIDA, or now the Community Liaison Office, they can hold the $5.4 million in engineering and they can dole that out in the future, but GMH could not continue until the end of December.
May I clarify? The definition in the SLURF as far as how the monies can be obligated are three criteria: the contracts, interagency agreement sub-awardee, and then any similar document transaction that requires payment. Those are the three criteria for then obligating the funds. And so the interagency between GIDA and I think DOA, is it DOA, then obligates.
Exactly. So they could have done an interagency agreement between DOA and GMH to take care, and then in the future, pay your contracts, right?
We explored that option, but unfortunately it was already kind of late.
Yeah, that's so unfortunate because they also deemed that you weren't eligible to be paid ARP funds for projects that you had already completed. According to your list, you submitted completed projects before the deadline, and you're still not reimbursed for those, and you have to find funding for those projects. Those are supposedly ARP-funded projects, completed, still not paid.
So those are obligated. It's just the pay down that when we get the invoices from the vendors. And I also just kind of want to add that the $10 million that was paid for vendors, one of them that relates to the CIP is Island Equipment that provides liquid oxygen to the hospital. They are a known vendor, but they also did a CIP, which is a liquid oxygen construction. So that was one of the vendors that got paid.
Thank you. And then Gura said they entered into mortgages. That's how they were able to obligate these funds. And you said something about transferring this to the government?
It's an option within the agreement. We could transfer it back
What,
to
the debt?
clear the debt.
The
Yep.
mortgage?
Yep.
So
it's an option.
The government is loaning you ARP funds. You're entering into a mortgage with DOA, but you might transfer that debt back to the government of Guam.
It's an option.
That's like some future financing that, again, couldn't be done for GMH's
it's due
current
diligence
obligations.
and keeping flexibility.
Thank you,
Senator,
Senator
could I
Chola.
just remind you that GMH said that they didn't need this because they'd already made the obligation.
They didn't need what? The 10 million in ARP funds?
They didn't need the interagency agreement because they'd already made the obligation.
We were exploring it. Remember, we had asked you if we can, but it was just kind of late in the game when we found out. So we explored that option.
It sounds like semantics, Mrs. Byrne.
Madam Chair, could I just clear the
Just,
record? There are,
if I would
there are
like to-
4 items to obligate the funds, not 3. And so it's in the guidance, you guys have copies too, and that's part of what we're talking about. These are complex matters, but to make sure the record's clear, there are 4 items. 1 of 3, but 3 mandatory that are required to meet a successful obligations. And I think one of them, as opposed to a purchase order, is the non-binding effect, meaning that the funds go away.
How is Gura pledging to repay these loans to the government of Guam?
Say again?
How is Gura pledging to repay the loans to the government of Guam?
Through the exercise of our multiple actions, we have assets, whether federal, non-federal, other grant opportunities, or we may just return it and do a straight trade like we do with multiple public facilities. This is not new. We may go buy a building for GPD or GFD, build the fire station and transfer it back. So whether it's a loan or otherwise, we're exercising multiple options available to us within the rules and regulations that we have to abide by. So it's all for the community.
So when they say
Thank you,
it's a loan,
Senator.
the government of Guam will not actually be getting any cash back?
Say again?
The government of Guam will not actually be getting any cash back?
They may, if Gura decides to exercise that option, or we may just return the land for the public use.
Thank you, Senator Terlahi. Senator Paris.
Thank you, Madam Chair. I think a lot of the questions were asked regarding the cost, and so to me that's really important, is what is it going to cost the people of Guam? And it seems like we don't have a definitive answer based on the fact that we don't have a site. Is that correct?
That is correct.
Okay, and I think these are very uncertain times, considering tariffs affecting the cost of services and goods, and the attempt to freeze federal funds. And so this is really concerning to me. I think this is one of the biggest issues for our people, is the cost of building this hospital. And for me, it's always been, I've actually made it a point to GIDA that, I support the healthcare complex as long as you guys can give us the most cost-effective route. And I still stick to that. And, I'm just concerned about the total price tag. And I don't think we're going to come away with this informational hearing with an answer But that's still, I think, my request to all the agencies here is getting the most affordable way we can build this hospital. Another concern that I have, we are, and again, we've submitted comments to the Missile Defense Agency regarding placement of missile sites, possible missile sites. And, to me, what I've observed through these years is that a lot of the infrastructure tends to be, there's a preference for our infrastructure to be built next to military bases, military sites. And so my concern is, we don't know the full effect of the Missile Defense Agency and where these sites are going to be. And I know there was some discussion that some of these sites are going to be in the very, or at least in the proximity of what the hospital location is, where the hospital location is going to be placed, or that's the efforts of this administration. And so would that have an effect on the funding and insurance? How would that affect the cost? We're talking about current cost as well as long-term cost.
I'm not sure I follow, ma'am, how the cost of construction would be affected by the proximity to a missile defense site?
That's correct. So if we know for sure that there's going to be a missile defense site in the back road, knowing that could be a target, how would that affect the cost of building a hospital in proximity to that?
I'd like to say this. You saw a proposed draft EIS. It's draft. So, whether we want missile defense in the middle of an urban area or proposed urban area central to the island or not, maybe more the question should be, if we want a hospital and if this is a good site for objective reasons, shouldn't we be first and have them work around us? Or should we, with all due respect, keep arguing about such a basic question to the point that we're, as a local government, running out of options on where we could build or what we can do? So there's still a huge gap through that NEPA process on when that proposed action could come out or anything happens. But I think there's definitely opportunity to have, maybe for the first time ever, have them work around us. Something to consider.
From the straight bond perspective, ma'am, no, it doesn't drive the cost up. The military investment in our island seems to make borrowing cheaper for us because they see Guam as not only do we have the tourism industry and the economy that comes with it, but we also have the military. So it's seen as additional solvency and liquidity for our island as a whole, and tends to drive the cost of borrowing down. And in all the kind of investor education that I've done with multiple investment companies, the question of proximity to sensitive sites never comes up as a question. And of course, there are the kind of the broader questions. Do you follow what's going on in North Korea, that sort of thing? But that's about it. It's the island as a target as a whole, not the specific Manila versus Totu or anywhere else.
Thank you, Senator Perez. Senator Barnett.
Madam Chair. There's just a whole lot of information coming out in this hearing, primarily because it's my opinion that when the governor couldn't get 8 votes in the People's House, it forced her to go outside and circumvent the legislature's rightful authority and ability to enter into this arrangement that we're now discussing with Gora. Doing a lot of the heavy lifting with the assistance of Gita. But my first question is for Ms. Mel, if you could. So we had been discussing a bill to appropriate $5 million to the Department of Corrections in the previous term, and it was said on the record that basically, long story short, the governor did not intend to construct the new prison because the application of that debt was going to be used towards the construction of the new hospital. Did you follow this?
I don't believe so, sir, but I have been following the evolution of the Department of Corrections.
Okay.
if you want me to talk about that a little.
That's what she said in the veto message. But I guess my question is, if that's the situation with DOC, how is the construction of the new hospital going to impact the construction of the new Simon Sanchez High School?
The construction of Simon Sanchez High School is already by leasebacks such as Simon Sanchez, such as the hospital and the Department of Corrections. They do not fall under the debt ceiling. So the debt ceiling is one thing. I don't think that's what she was probably addressing. I believe she was addressing the capacity for the capacity for annual debt. With regard to DOC, I believe the size of the facility was of larger concern. So without, I believe that if that project had been, from what I saw, from where they started to where they were wishing to go, if there had been somewhere in between, I think they would have been okay. But I think that,
Thank you, Ms. Bell. I only got 5 minutes. I appreciate that. Mr. Fernando and Director Napoli, you had talked about a purchase that's currently ongoing for lot 5297, and I don't believe that you stated on the record who was the lot being purchased from.
I'll send you the details, and we may have already posted that on our website, the appraisal of that property. I believe it's the estate of, I don't have the first name, but I believe it's the estate of the Perez family. So it's just similar to the Camacho family. It was a land returned.
Is this also land that's connected with a GITA employee, or no?
Not that I'm aware of, yeah.
And then Deputy Director Estevez, in the Agora board meeting where you guys had passed the resolution to proceed with the land condemnation, you had said, and it was just a little comment, but it caught my ear, you had said on the record in the meeting that there were things that the military had told you about, I assume, the construction of the new hospital that you weren't, for whatever reason, able to share with the general public. So I just ask now that you expand on that, and if this is an issue of national security or some type of security clearance.
Not. And I think it came out in the DIS when you look at their evaluation, probably one of the only socioeconomic things that they actually truly hit on as a significant adverse impact. Because one, they didn't evaluate the capacity. So there's a huge gap between the increase in population that's being proposed, the increase in population that's already had that we proposed at the housing summit of around 15,000 people, and zero investment from Department of Defense. So whether there are ongoing discussions, high-level meetings, it's hard without a final price, but the data is there to support. And, you know, having made the case to get, Gura having made the case to really get Guam $500 million, I can say confidently there is a strong case to get funding for this hospital, provided we can get our ducks in a row and get a price tag to go chase after that. Thank you.
Sorry, Madam Chair. You had also said that you had zero concern about the court cases that are playing out in both the local court and the federal court. I don't necessarily agree, because I believe the legislature absolutely should have had a hand in this process. But in the event that the federal court rules against Gora and the governor, what then would happen with the construction of the new hospital?
So to reiterate is, you know, we may have our disagreements. I think only the attorney Terlahi has her degree, but her law degree, but whether they agree or not, the Supreme Court has already ruled on it, and it's based off federal precedent set on Wang v. Kamina regarding how funds are used. So, you know, we of course did our due diligence and ensured that, crossed our T's, dotted our I's, made sure. So yeah, I say again, zero worry.
I know, but what if the federal court says that you didn't cross the T's or dot the I's, and Mr. Estevez, you're incorrect in having zero concern, you lose?
I'll resign.
Thank you, Madam Chair.
Thank you, Senator Barnett. I guess we can go for one final round of questions, but if we could just limit it to one, because I know everybody's been here quite a long time. Senator Duenas, did you have anything else?
Thank you, Madam Chair. Yeah, in my last discussion, I actually only had one thing to go on with Mel again. Then, you know, given the presentation that you've made, I'm just going to say from my perspective and planning purposes going into this fiscal year, I'm going to count on the fact that it's going to remain $35 million in terms of the appropriation. Do you concur?
For this fiscal, sure. For next, no promises.
Got it. You heard it, Ed.
Yes, sir. Very loud and clear.
Thank you.
You know, I do want to reiterate, though, Senator, that the construction going up is not a function of the government of Guam or anything like that. We all know what the military buildup is doing to the price of construction, and I can only foresee this continuing to, this situation continuing to be challenging. We continue to rise to the challenge, but the longer we delay, the more expensive it becomes. And so we would very much like to press forward at the $35 million a year price tag, Senator. I will endeavor to do that as best I can. Yeah. Having said that, there are certain things out of our control that we can't foresee, and I just know what I've seen in the last 2 years versus 4 years versus the next 4. So.
And I fully appreciate that. I guess I wanted to reiterate once again. There was made presentations that outside of what the debt service is currently calculated at, there were many opportunities. And so I guess just wearing my hat that I'm wearing now, I'm imploring that we ensure that all other options, all other funding sources are indicated, because I believe most people are expecting that this $35 million appropriation that we're putting out annually is for a hospital. If you go, when we go to lunch today, a late lunch, I think the average person on the street will say, we need a new hospital. So I'm benchmarking based on the $35 million that we've appropriated consistently, and that will hold true to that at least for fiscal year 2026. Thank you.
Thank you, Senator Duenas. Senator Terlahi, your final question?
Yes, a couple. Just I'm confused between the $104.8 million that you've set aside, and you said it's going to be used for GPA, GWA, waste engineering, GIDA's fees, $1 million. Yet you said the phase 1 price tag is $5 to $6 million only. So what does what phase 1 include?
Phase 1 environmental, ma'am?
I don't know. You said phase 1.
Phase 1 of the hospital, the construction itself, I think I said 600 to 800 million. I think that's what I said a few minutes ago.
No. Earlier, okay, well, I thought you said that phase 1, you're going to do this in phases. Phase 1 is a $5 to $6 million price tag, and I was asking you to, how does that balance with this 104 that's been set aside, 104 million? So all this infrastructure, can we call it, that's actually your phase 1? You intend to spend all the 104 on all of these projects first?
The infrastructure is meant to support all the phases of the medical campus. Nevertheless, you need it for phase 1, so yes.
Are you going to spend it all on these projects first?
Yes.
And this doesn't include the money that was loaned to GURA?
Correct. They're under different object categories on the obligation.
Is GURA intending to, they've planned to take about 54 acres total between purchasing and condemnation. Are you intending to continue that condemnation until you get up to 100 acres?
We're, with what we've proposed on the list that's provided to you, that's already about 100, 204 acres already. We're there. Yeah.
So what do you mean? You've already purchased or condemned 100 acres?
No,
because you keep talking about 54 acres.
We've purchased 48 acres. That was the Camacho
48
estate.
purchase, yes.
The Perez estate that's pending approval at the court was a sale, and that was about 14.5 acres. I can get the specifics. The Hongyi Tien, which incorporates 4 house lots and the primary
what's the total?
lot.
The total?
The total of all the properties.
Of that you've actually dealt with, yes.
Say again?
That you've dealt with so far.
104 acres.
So why do you keep talking about 54 acres if you've got 104 acres already at your disposal?
So if you look at the map, and this is the best way to reference,
is it because of this big blue mark here that's unusable?
I can answer the question if I may. Thank you. There's an unimproved road here that's an actual easement that exists that's going to be a demarcation. So from a community planning perspective on where you want to focus efforts and to consider what's liable or likely for feasibility, for further feasibility, it's about priority. And so when you connect the 5327-4 at R5 plus the smaller lots, and 5297 makes up 52 acres, which is fairly comparable to what was originally designed for the primary hospital superstructure. That doesn't include the ancillary facilities as part of the medical complex, assisted living facility, additional parking, things like that. Would you like me to speak slower?
I don't understand what's your distinction. And so what is this big blue mark in the middle of the paper? Is that usable or not usable?
That indicates a 0.01, the 500-year FEMA flood, which just means anything we put there with federal funds would require flood insurance. Yeah.
All right, and so there are some properties in the area that are not marked with your black lines?
Yes.
So, does that mean you're not going to touch those properties? They were spared from condemnation?
Yeah, and we explained the rationale on every single lot in the entire vicinity, and that's available publicly in our board meeting, our board meeting November 26th when we briefed the board prior to the actions.
And did you explain why you're taking property across from the 6-lane highway?
It's part of the same property group, yes.
Why?
Say again?
Why?
It's part of the same
but why do we need the property across the 6-lane highway?
For community development.
For the parks?
No. Actually, that whole frontage area, and I'll go ahead and put it out, is we're looking at a portion of the DR to do a mixed-use, mixed-income community development to be associated with the medical complex to provide affordable housing for the low income and attainable housing for the middle class income to improve the community. That's our vision, that's our goal, that's our plan, and that's what those properties are for.
All right, so what was the total in ARP funds that you got for this?
Totals, yeah, about 12 million. Yes.
12 million.
For this.
Very similar to what GMH is lacking.
2 million? How much did we get for somewhere around for admin costs, right?
12 million and
300,000, I think, 500,000 total. Yeah, I'll go back and check, but we received for admin costs too, which is a separate agreement.
Thank you, Senator Terlahi.
Can I just ask, did you say you were going to build parks? That part of this?
I didn't say we're going to build
ARP
parks.
I'm saying set aside for, I mean, so part of this land condemnation is being set aside for parks?
No. I'm saying in areas, particularly on the Camacho estate, where there are sinkholes and you may not be able to put a structure, you can build a park.
How
but
many
that
of
is
those
not on
are
the
there?
condemned property.
How many of those are there?
Say again?
How many sinkholes?
There are 3, and they all reside on the lot 5280-3, and they're well defined, and they're included in the ARP cost of the $104 million, as you can see in the assessment, are all the boring that needs to be done to see how close you can put a building and how big that building could be. In the event that we cannot put a building, it can be used as green space still, so it's not wasted property. And the sinkholes themselves, standard engineering, can be used for the stormwater management as long as you have an infiltration basin. So we can provide the engineering estimates, but we do a lot of construction. And
Thank you very much.
Yes,
so
it's all well thought out.
Yeah,
Thank you.
Madam Chair, thank you so much. I wish we had a little bit more time for some more questions, but thank you so much.
Thank you. Senator
Better worse than
Perez.
Yeah, just a question about reconciling the ARP reports. And so what I'm seeing is that there's a difference between the end of January, the end of December and end of January. So Director Byrne, can you explain what was 29 million spent in a month's time that was allocated to the hospital, the new hospital?
Senator, could you help me and show me what you're looking at?
Okay, in looking at the report that was submitted January 8th, it states that there is 133 million for the new hospital, and then when you look at the next ARP report, it's 104 million. So there was a difference of 29 million. How was that used?
I'd have to go and research it, but 10 million of it was used to pay down the hospital vendors.
No, that's a different category. If you look, yeah, it was used differently. So this is specifically for the new facility.
Yes, and that was reduced in order to fund the hospital vendors.
Okay, maybe we could take this offline, but I know when looking at this, it was a different category that was used. The other question that I had earlier, but it wasn't answered for GMH, is anybody from GMH here that can answer the question? Yes, if you want to come to the table. It's in regards to finances. Do you have information on finances? Okay, yeah, so I guess I would have to bring this question to Lillian. But yeah, the question I had, because they were rebuffed in having to use the money for CIP, but yet after that date, they were able to reshuffle the money to vendors. And so I would just like to know how was that decision made, considering that they needed to spend the money for critical CIP projects. And that question was not answered earlier, so I would like to get an answer for that.
Okay, my understanding, Senator, was that the decision was made to pay down the vendors so that they could use future cash flows now freed up to pay for the CIP projects.
Yeah, but in looking at the ARP reports, there are several accounts, right? And it's clear that one account was reshuffled. So for instance, the CIP projects was reshuffled to vendor payments. So that's different from the new hospital.
Yes, no, the answer that I gave related only to the GMH.
Yeah, I think there's a lack of clarity here, so maybe I could speak with you afterwards. But thank you,
yes,
Madam
Senator.
Chair, for the.
Thank you, Senator Perez. Senator Barnett.
Madam Chair, I couldn't agree more about the lack of clarity, and I thank you for the opportunity of this hearing to have these officials sitting in front of us. So just for the record, the GMH that was the $10 million that was taken from GMH, there is no way that we can enter into a intergovernment agency or otherwise unobligated to assist GMH with the current conditions?
Not at this stage, Senator, because everything is obligated.
For Mr. Estevez, I guess because I got a text from my auntie who's watching the hearing, and the question was asked, if I may, why would you purchase property that has 3 big sinkholes on it? If it's not, and it kind of sounds like you're not even going to use it for the new hospital. I actually heard you on Ray Gibson's show saying that it would be a design feature, maybe a wishing well or something. So I guess maybe explain why you would do that.
Yeah, absolutely. Well, part of the property is going to be used for the major infrastructure. So I think there's already GPA has plans to put they needed like 2 acres for the substation. Sorry, that was GPA. GWA is still making the determination how much land they specifically need for the reservoir, which will go on that property as well. The sinkholes themselves, yes, and there are permits granted for this, and you can find this and discuss with engineers yourself. Any large development is going to require stormwater management as part of environmental compliance, right? And so sinkholes can be utilized because it's a natural drain for that stormwater to go into, provided in your permit. Say again?
Sorry, Mr. Estevez. Doesn't it seem a little premature to make a lot of these assumptions when we haven't done the assessments and the necessary surveys, geological, environmental, et cetera, et cetera?
No, not for stormwater management, because you can look at the big blue blob, water goes in those sinkholes. That's how these sinkholes are made. So you know the water already goes in there. The environmental engineering part and the design feature is to utilize that, control the water, make sure it's clean. That's the hard requirement. So you do infiltration basins, add other ways, test it periodically from the infiltration basins, and then utilize have the water go into those storm drains, which it goes into normally. And so that's what we talk about, incorporating environmental natural design features into the project. Either way, whether there's sinkholes or not, when you're going to be disturbing that amount of land for any major project, you're going to have stormwater issues. So you need to manage that stormwater. That's why we have ponding basins all over the place. So yes, it's not a wasted feature. What really makes the lot not the best is it's shaped like Idaho. So you can't put a large structure there, but you can get creative in, again, parks, potentially, smaller ancillary facilities and clinics. So remember, this is a medical complex as part of community planning, design, and development. The hospital is one component of it. So I know it oftentimes can be, get mixed up.
It just sounds like there's a lot of issues with this property that we purchased.
The engineers would disagree.
Well, I'd like to see the assessments completed, but with the condemnation, I've heard you continuously say that this is something that GORA regularly does and has done in the past. So when was the last time that GORA successfully executed a land condemnation?
So land acquisition, GORA has been doing since its inception, and under the law, acquisition is broadly defined to include eminent domain. It's explicitly defined to include eminent domain. So it goes from purchases, deeds, gifts, all of which GORA has done. Now, as far as eminent domain, there was urban renewal in the 80s. That was asset redevelopment, but that was an urban renewal project, not a housing project.
So the last time GORA took people's land and condemned it was in the 1980s?
Correct.
Thank you. I think for me, the issue with the new hospital is, even based on what we're hearing today, is we're not really talking about the new hospital, which the people desperately need. We're talking about these grand schemes, if you will, for lack of a better term, that include a medical complex that Mrs. Mendiola said could possibly include GIBWIC or public health, but we know, because we've been discussing this for the 2 years I've been a senator, that GIBWIC is going to expand on its existing footprint. And we also know that public health, the laboratory that was initially slated to be included in the medical complex is now being constructed at the University of Guam. And so I think the desperate need for a new hospital brought on by this administration's neglect of our island and our people's healthcare system, I think it's just a lot to swallow, frankly. That we're going down this road of condemning people's land, taking people's land, purchasing other lands that I'm just kind of scratching my head. Why would you take somebody's land and then pay for land that it doesn't even really seem like we can use because it's shaped like Idaho and there's, I'm not sure how many sinkholes there. But yeah, we need the new hospital. We don't necessarily need an economic investment area in Manguilao. And that's all I'm saying is this conversation is getting so far away from what the people of Guam actually need and getting really into these long-term planning things, which are all well and good. But the problem is we've run our healthcare system into the ground through neglect, and now we're expecting our people to just wait it out while we enter into this area that's very uncertain. We haven't done the assessments. And then if you could, Mr. Esteves, so the need for the 102 acres, and this is also...
Thank you, Senator Barnett.
Thank you, Madam Chair.
Thank you. And thank you, everyone, for appearing today for this informational briefing. As I mentioned earlier, this will likely be followed up with an oversight hearing. And that concludes today's informational briefing. It is now 1:54 p.m. We are adjourned.